One. Hi, this is Emmy Thomas, and I'm here with Willy Wonka. I'm going to start off as I do every time and ask Willy, what is it like to be you?
Um, I definitely thought of this. I knew you were gonna ask me this. I know you like roller coasters, and I know this is kind of a cliche thing to say or metaphor, but I definitely have felt like I'm on a roller coaster, but it's a different roller coaster than what you're used to because you can't see what's ahead. Normally, when you're on a roller coaster, you can kind of know, okay, I'm gonna go up, then I'm gonna go down, and like, I don't know. Also, the people who are around me are constantly changing. And I don't know always if the person next to me is going to unbuckle my seatbelt and throw me out for a laugh or hold on to me and like comfort me or what. So I'm trying to like figure out the people around me. And then there's also people who somehow got off the roller coaster and are just watching, and I'm trying to get there.
Hmm.
That's what I feel
Yeah.
like. And then the way I handle that is just like kind of breathe through it. like kind of,
Uh-huh.
I do a lot of, I kind of like try to live in a mindful way, like mindfulness meditation, um, and I've definitely experienced trauma, but I don't consider myself like a victim.
Mhm.
Um, I think I did have kind of a victim mentality for a little bit, but not anymore. I'm not like a survivor. I don't consider like I don't use those terms to like describe myself. And I don't use like words like, oh, I'm triggered. Like, don't say that. I'm not I understand triggers differently than most people throw that word around nowadays. Um,
How do you understand it?
for me, a trigger is like when something happens, some sort of smell, image, or a situation that's like ambiguous. Maybe for someone who's traumatized will interpret an ambiguous situation as being a threat. But a
Uh-huh.
trigger is like I give like the typical example of like a Vietnam vet, something happens and then they're back in it, fully in
Hmm.
it, and the reality is not there. That's what I consider, and I feel like a lot of people are like, I don't like what you said, I'm triggered. And that's
Mm.
not, to me, that's a very minimal, I mean, that's just like you're annoyed, you know?
Yeah. Yeah, it's interesting because I've never, and I just read a tweet this morning that was like people who are sensitive to triggers, will probably eventually condition themselves to be triggered by trigger warnings. And
Yeah,
so it's a really interesting question because I've never thought, what does it mean to be triggered? What do people mean
yeah.
when they're triggered? When I say it, I guess I mean
Mhm.
that I have like an emotional reaction that's something more than what is warranted by the situation. Like there's something
Mhm.
kind of internally. And I think that kind of like is a little bit what you're saying, like with the Vietnam veteran example,
Yeah,
which is, they hear a loud noise and their reaction is more than just what's currently there in the present
yeah,
with that context of the loud noise. They're
right.
suddenly thrown back to a different time, or
Yes.
they're suddenly feelings, are of
Your
something else.
perception, yeah, your perception of the situation changes back to that, partly because I think that would be like a flashback, right? A, I think of triggers, create make a trigger a flashback, and a flashback is when you're back in like you know some guy looks at me the wrong way and I think he's going to rape me, because
Yeah.
I see that person now as not that person, as another person in another
Yeah.
situation. Um, and then there's like the issue of people who are traumatized constantly going through that same cycle over and over again. Well, why do they do that? There's actually a theory called the mastery and control theory of trauma, where it's
Hmm.
like, I'm going to put myself in the same situation, but I'm going to get it right this time. I'm going to win. I'm going to
Mm.
control it. And that's an unconscious thing,
Yeah.
you know, because it can go either way, depending on, you could win, you could prevail and feel like you've got some sort of power now over that type of situation. But it's like, yeah, it's enactment, I think it's called, in like psychoanalytic therapy or trauma
Uh-huh.
therapy or both.
So people are, like maybe would this be an example of what you're talking about? Let's say I have been assaulted. Let's say I was like mugged at an
Mhm,
ATM, like taking out
mhm,
some cash or something. And
mhm.
it's like late at night, maybe it's, dark, it's kind of like not well lit, there aren't
Mhm,
many people around. And so maybe I
mhm,
would keep putting myself in those situations of where I
mhm.
might, I was more likely to get mugged just so I could like come out ahead. I've also taken
Yeah,
now self-defense, and now maybe I
yeah,
also carry mace. And so I'm just
yes,
kind of daring that person to like,
yeah. Yeah.
that's interesting.
Yeah.
But so what
And
do you
there
think
was,
normal people refer to when they say they're being triggered? What do you think? You said you use it differently than they do.
right, like, well, I rarely use the word because
Uh-huh.
if I get triggered, I usually just leave. I don't
Okay.
like right now, like I'm sober now. That was very different when I was drinking. And that's something I think is interesting with alcohol and quote unquote normal people. Some people drink just to be able to do the thing that they can't do
Oh,
sober. So,
this
and
is
for
really
me,
interesting to me because I don't understand it almost at all. Like, I don't understand
yeah,
people who, like, I see people all the time who are living like half of a life, like a shell of a life,
yes,
because there's so many things that they kind of want to do, that they
yeah,
just don't do. Now, some of these things are kind of like quote unquote bad things. They want
yeah,
to tell off their boss,
yeah,
or they want to, like go on a rampage, or they want,
yeah,
uh, but like a lot of it's just kind of, it just is weird to me. I just don't understand
yeah.
why people don't just do those things that they want to do so
Like
badly.
drink if they want to drink.
Well, you just said people drink because that it allows them to do the thing that
Oh
they
yeah,
can't
do
do
the thing
sober.
that they want to do without that. Um, I think part of it is like being drunk is like you can be like, oh, I was drunk.
Oh,
It's like you can be like an excuse. Um,
so,
and
so this
this
is,
is a sober alcoholic talking.
but real quick, this reminds me, I was just reading this too. I was rereading one of the psychopaths that I met. She, in like kind of a moment of like odd innocence, she was saying, like, how sometimes people say things like when they're really angry or really drunk, and then afterwards they say they didn't mean it. And she's like, but I wonder, maybe they did mean it. I was
Yeah. So I can tell you about that
psychopaths. Uh-huh.
because I would go in my boyfriend would know when you get to this part of the label on the Jameson bottle, you're blacked out.
Hmm.
And he would say, and I would say the same thing. He's like, you don't mean anything you're saying right now because you're in a blackout. And I say, I'm not in a blackout. I'm going to remember everything I said. And then the next
Uh-huh.
day, I'm like, why was I so angry? And he's like, I took away your bottle. And it
Oh,
was like, I'm not angry about that the next day. Like, I get it, but like
yeah.
in the
Uh-huh.
moment, you're taking away like my binky, like, you
Yeah.
know?
Uh-huh.
And I
Hmm.
think for me, like my addiction, so in 2008 was the last time I did heroin, and I just celebrated a year without alcohol. But I've been
Mm.
around AA since I think I went to my first meeting when I was 16. Um, they didn't know what was wrong with me. I wasn't diagnosed with bipolar disorder till much later. So there was
Okay.
like always this question of what's what's going on with her. My mom was always reading those parenting books, and I was always doing I was always like doing behaviors that were very not normal. Like she would find out from these books. But then, so my parents, when I was growing up, were kind of, I don't want to say they're narcissists, but I think that they were in a very narcissistic phase because they were moving from a very poor socioeconomic status to being very wealthy. And they wanted, to fit in and fit in
Uh,
at their country club. And my mom wanted to be a doctor's wife and do things related with the other wives. Like they would have fundraisers and stuff. And I was kind of like an ornament.
okay.
And um, and I was very lonely. I was an only child for the first 10 years. And I remember being alone a lot. And then like my behaviors started, my parents say, around like 10 years old, which is when my sister was born. So I think that there
Mhm.
was some abandonment there just because I was a very, like, my first word was no.
Uh-huh.
And
Mhm.
like, I was just very, like, wanted to do my own thing. And my parents weren't very, I don't want to say they should have been they should have been a little more aggressive with me as a child. Like, I can look back on that. Like, they didn't give me a lot of like limits and boundaries. Like, I always say, like,
Oh,
Willy, it's funny, I'm going to bring a Willy Wonka reference, but I was definitely Veruca Salt. Do you remember Veruca
okay.
Salt?
Yeah.
That was
Is
me,
she
that,
the one that
and my
sings I
dad.
want the world,
Yeah,
I want the
yeah, I
whole
want the whole
world.
world. Yeah,
Uh-huh.
yeah, that was me. But I kind of got like, I just remember they tested me because they were like, is this girl like kind of stupid? Because it was always like that doesn't play well with others, you know? And they tested me like IQ tests and achievement tests. And they could tell at the part of the test where I was like, I'm not doing this anymore. I'm just filling in whatever. So they knew like halfway through, I was just like, because that was the issue. I wouldn't do anything anybody wanted me to do, for the
Mhm.
most part, even if I wanted to do it. And this is what I was diagnosed with oppositional defiant disorder, which is like
Okay.
phase one, sociopath. After that,
Right.
it's conduct disorder,
Uh-huh.
which I think, if I would have
Is that the
not
what the
been,
order that it goes in? So it goes first you
yeah,
get
usually,
diagnosed oppositional defiant disorder, then conduct disorder, then psychopath.
I mean, if they catch it early enough,
Okay.
you know, um, So yeah, I mean, and I had always had really intense emotions that I didn't realize that that's what was really going on till I, when I was in graduate school, was in an advanced Rorschach class, and we had to get a partner, sign like consents to not talk about what we find out, and you get a partner and you give that person the test in front of the whole class, and the whole class does what's called query, which is like you give your response, and then there's like when you do the Rorschach, you are a robot. Everything you say is, you have to say, what might this be? That's the only thing. You can't say, what is this? What do you see? What might this be? And then when
Hmm.
you go through, you have to go through, get all their responses. And anyway, we did this. And this is when I really because I did it very honestly when I took mine, and it predicted a suicide attempt for me while I
Mm.
was in a manic phase. And the reason I became, I got really heavily into, after I got sober from heroin, I decided, I was in South Florida, and I had sponsored a lot of people in AA. I got sober, I had like 5 years, but I was kind of like in an AA cult, and I didn't like
Mm.
realize it because different groups in AA are different.
Hmm.
And I kind of like, you're supposed to turn your will and your life over to like your higher power, but I was like turning it over to like these gurus in AA. There's a
Okay.
lot of, so for a while it was like I wasn't really thinking for myself. I wasn't on any medication. I was completely sober, and I was getting like straight A's in school because like for the first time in my life, and it's funny because I really felt like in the back of my head, I was given a Rorschach, and I was so fixated on what was that from when I was 17 that I had to do it and like see what that was all about. And I was in therapy my whole life because, I realize now that I was the scapegoat or the indicated client of a system, you know. So sorry, I'm going all
What?
over the place. I
Yeah.
mean,
What does that mean? An indicated client of a system.
so like when you do family therapy, I studied family therapy and I was in family therapy. There's like one theory where like everyone has like a role, you know, like the martyr, the golden child, the lost child, the scapegoat. And I was like the scapegoat. Everything was always my fault, and I took on that identity. But also, I should mention this: when I did acid when I was 16, it like wiped out my personality, and I had to like start over.
Mm.
And so I don't know what that did to my personality, but I know I was a lot happier like after
After the
that.
acid. Yeah.
Yeah, I mean, and you wouldn't think that it wasn't a happy experience because it was terrifying. I was in a private all girls school. I was definitely always the like odd one out. I always felt I kind of at that point in my life was like, all right, I'm just on my own. going between, I could be friends with anybody, you know? But when I tripped, it like didn't wear off. I was like, all right, when am I gonna sleep? And it was just like a whole new reality. Eventually I
Oh,
slept.
interesting.
Yeah, I couldn't remember like what I used to think about before the acid trip. I couldn't remember what I liked or disliked. I couldn't remember anything. And
Hmm.
I kind of had to like start over and like push through. And I
Mm-hmm.
probably was psychotic, you know, but
Yeah.
I was so weird anyway that they didn't, nobody noticed, you know, but, you know, and then after that, like, so my feeling was, well, why did everyone tell me drugs were bad? Because they really, like, the first time I smoked pot, it was like my, all this noise in my head went off and I felt like I could have a conversation, you know,
Mm-hmm.
so I assumed everyone was lying to me. And I think also from a very young age, my dad's a radiologist and I was like, Dad, my stomach hurts. I was like probably 5. And I was like, give me an x-ray. And he sat down and drew a picture. And I'm like, that's not an x-ray. Like, who do you think I am? You think I'm an idiot? And like, that was kind of instilled in me that adults are going to lie to you. They're going to lie to you because they're lazy. They don't feel like doing the thing or telling you the truth, or they want to like protect you. And I think I was like, all right, I'm on my own to figure this out. Sorry. Yeah. Cut me off.
Yeah, well, I don't know that they lied to you because they're lazy. Now, I have
Yeah.
I have a ton of nephews and nieces, right? And even
Yeah.
before that, I had like, I don't know, cousins with kids or whatever, like, uncles and aunts, like,
Uh-huh.
my parents have a ton of siblings too. So I
Yeah.
had like young cousins that were a lot younger than me. So I've always been
Yeah.
around babies and children. And one time I did lie to one of these like little relatives of mine. And my mom explained to me, like, don't lie to children. They know that you're
Yeah.
lying to them or whatever.
Yeah.
And then it just kind of like ruins the trust. Now, I don't know that. So my girlfriend Aria, she then kind of inherited a
Yeah.
bunch of little relatives when
Yeah.
when we became life partners, I guess. And
Yeah.
so she does not have the experience with small children,
Yeah.
like hardly at
Yeah.
all. And so she did kind of lie to one of them. And I was like, oh, let me just tell you this story about my mom, when I was like 12 or 13 or 14 is when it
Uh-huh.
happened. And she was like, oh, okay, and I just think it's like people just don't understand, don't kind of care to put themselves in the shoes of children, I think is often the thing.
Yeah.
Like it's not like they're trying to lie because they're lazy
Hmm.
100%. Maybe a little bit of it is that, but I think it's they don't know how to talk to the kid. They don't know if the
Yeah.
kid will understand. They
Yeah.
don't think that it's the kid's right to know, maybe, or whatever.
Right.
And so, so I just think it's like a little bit more complicated than just that
It's
the
very,
adults
you're
lie to
right.
children
You're
because they're
right.
lazy.
I know. That was probably my perception when I was like 5 or
Yeah,
whatever.
yeah, yeah.
But
Hmm.
no, it is true. I mean, I work with parents who, yes, that's very, very true. And yeah. But yeah, that's very, very true. People just don't know what to say. And I guess because of my training or just empathically, I seem to have always, I am a huge empath and I want to, we can talk, I want to talk about that too, about
Let's
the
talk about it right
cons.
now.
Okay. Okay. So having been an empath my whole life, it was really hard for me to tell my emotions from other people's. And like when I'm around people, I can like I guess I think I'm I think this unconsciously aware of like what's called micro expressions.
Oh,
And there's also something that I want to tell you about called mirror neurons. Have you ever heard of mirror neurons?
yeah. Don't they kind of think that these are in part, the explanation for kind of the sensation of empathy is that, like, if
Yes.
you see, I think this is true, kind of my understanding. So let's say I'm looking at like I'm a child, I'm looking at another small child on the TV, like lifting up their arm and putting it down. There may be
Hmm.
like in my brain, the same kind of neurons firing that would be firing if I myself was lifting up
Yes.
my arm and putting it down.
That's
Yeah.
exactly. That's it. That's it exactly. So you can imagine, like, if I see someone get a paper cut, I feel that because my mind, my neurons are lighting up the same pattern. And that's constantly happening all around me. And I took mushrooms, like, I mean, I took a big dose, like 10 grams.
I
In
love all
my,
these, like,
I
I
got a
took
lot
this,
of
I took
stories.
that. Yeah, okay.
I think I don't know, like when I have I don't know if I believe this for sure, but right now, currently, I'm believing that we choose our life before we're born, beforehand.
Yeah, that's Mormon
And
theology.
are you serious?
Yeah.
I want to, and I noticed that nobody asks you about that. And
About
like I
what? Mormon
always,
theology?
no, just you're a Mormon, right?
Yeah, I
So
talk about
like,
it, I feel like every single video.
oh, you do?
People
'Cause
are
I feel
probably like
like
sick of
maybe I
it.
just haven't heard the ones
Yeah, they're
that
probably
you've
like,
talked
I'm done
about
with
it.
Mormonism.
But like I mean, because people, well, wait, what were we talking about before? Because I'll go on like 50 tangents, so you have to kind of rein
Well,
me
you're
in.
talking about kind of being like a super
Mirror
empath, and
neurons.
you're saying that you choose the life before you were born. That's your current belief.
Yeah, that is my current belief. And then about mirror neurons, they found that you can look at people with autism, and it's like the more autistic they are, the less neurons they have, or less mirror
So
neurons they have.
I have a story about this. So I went to they're called like neurobiofeedback. I don't think I've told this story
Uh-huh.
before, so hopefully I'm not repeating myself. So
Uh-huh.
neurobiofeedback is kind of like a very simple version is like when you with your Apple Watch or something, I think you can do things where it's like they're trying to get you to lower your heart rate or whatever.
Yes.
So you are doing something in your brain that's affecting your body, and you get the
Uh-huh.
feedback via the heart rate monitor that's in your watch, right? That's all it
Yes.
is, neurobiofeedback.
I've done it.
Yeah. Oh, okay, okay.
I've done it all, Emmy. I've done every single
You've done
therapy.
it all.
Done it
So I'm
all.
doing it for sleep, and partly because
Uh-huh.
actually the dude was somebody that my mom had a friend who went to this guy, and she was like, actually the friend kind of like changed like pretty dramatically as a result. So
Uh-huh.
she's like, yeah, like maybe this will help you and also take your
Yeah.
brother.
Yeah.
Because we have the two, she described us as like having broken brains, and maybe this guy was going to
Oh,
help.
jeez.
So I took me and my broken brained brother
Jesus. That's not very
to
nice.
these like whatever every 2 weeks or whatever for a while. And I was mostly kind of being like, he was like, what do you mostly want to work on? And I said insomnia, because
Uh-huh.
insomnia has kind of like plagued me off and on. Although I have like a new trick that I'm hopeful that will like really limit the insomnia. Like learned a new little trick my own self
Hmm.
from just trial and error.
Yeah.
So he was like,
What is
he
it?
first does like, I'll tell you in a hot second. First
Okay.
he does like you watch static or something for like 15
Uh-huh.
minutes, and it's just to do what he says, like a baseline level of your kind of brain activity. And then afterwards, he's like going through it, right? And it was like my mom was there, so was my little brother. He was like, "We'll just kind of do them all together if you guys don't mind." I was like,
Uh-huh.
"Sure." And so he was like kind of going through it, and then he got kind of serious, and he was like, I don't mean this to be like alarming or anything.
Hmm.
And it's not that big of a deal, and we do see it, as being a little bit more normal in like the autism community. So there is a
Uh-huh.
population in which this, is like relatively common. But he
Uh-huh.
was like, you have super low levels of brain activity in the
Uh-huh.
area of the brain associated with recognizing faces, with recognizing other
Hmm.
people's emotions.
Hmm. My boyfriend is
uh,
face blind.
oh, really?
Yeah, that's a thing. He knows people by their voice and their silhouette.
Mm.
So that's interesting. And I thought he was a sociopath for the longest time. Like a bad one, like one that doesn't have any self-awareness, or like, but he's not. He's an INTJ. Do you know the Myers-Briggs?
Yeah, I'm also INTJ.
Yeah, so oh, my mask slipped. Hold on.
Mhm.
Yeah, he's an INTJ. I'm an ENFP. And those
Okay.
are, and so they do research papers on INTJs and ENFPs who are in relationships, because we are so opposite. but we're
Okay.
so balancing of each other. You know,
Uh-huh.
he's very disciplined. He's on the same schedule. His mood is a steady state. No one can provoke him. I think he's a genius. You know, but he's very disciplined and organized, and he has like the perfect way to do everything, like the perfect procedure. He thinks procedurally, and I think like in loops, you know, in spirals, like, and
Uh-huh.
I have like loose associations, and
Yeah.
but like with the empathy thing, like him and I were walking in an airport because he considers himself to be very aware of his surroundings, always know like if there's a threat, you know, like constantly
They
looking.
call this situational awareness. I know this because I have brothers.
Yeah, I'm usually not fully aware of the situation, but if someone is hurting, like, or someone's about to get hurt, like, for example, we were walking through an airport, we were kind of late, and I see this, I'm not paying attention to anything, but I see this woman and I'm focused on her, and I look at her face and I'm like, she's about to pass out. And
Mhm.
I see her and I go into a like a I go on my knees and just slide and I just missed her. Like I
Oh,
almost got her. My boyfriend's like, "What are you doing?"
uh-huh.
And her tooth fell out. I got her tooth. I put it in water like so she could get it back in, and like afterwards he was like, "How did you see
Her
that
tooth
coming?"
fell out because she hit her head or something?
I saw her. She was passing out. And when I see this happening, like there was another woman who was just walking down. It's like they have a light around them. Like I'm supposed to talk to these people or supposed to, but like just was in focus. I looked up and she was in focus, and I could see her face. She was about to just lose consciousness. So I just went
Uh-huh.
into like a slide. I was like on my
Uh-huh.
knees, sliding over with like my hands out, I was trying to catch her face before she hit the ground, and she face planted. I just missed her.
Oh, okay.
And then I saw her tooth fly out, so I grabbed her tooth. And then a bunch
Wow.
of other people came over. Yeah, and my boyfriend was like, he was just all he could care about afterwards was, how did you see that coming? Why did you
Yeah.
see that coming? How did you see? He's like, I'm always seeing that. But he was just happened to be scanning a different part of the area, you know?
Oh, uh-huh.
And like we
Interesting.
met an old lady on this was when we were first dating. He was like, you have special powers. We were walking down the street and there's this old lady, and I could tell, and I was looking at her, I smiled at her, and she reached out to me and she couldn't speak English. And I
Oh.
immediately knew this woman's lost and she has dementia.
Mm.
And my boyfriend just thought she was, and we ended up taking her to our place. Her first daughter, we called her daughter. I said, you know, if we figured out, get her phone, look at her phone, find someone, call them. And her first daughter wouldn't come and get her. We were like, what?
Oh, uh-huh.
Then the other
But
sister did come.
first daughter is like the title, like cultural title of that daughter, right?
Oh no, the first daughter we called. I
Oh, the
don't know
first
like
daughter that
what.
you called. You
Yeah.
so it just is under in her phone it says daughter or something?
I think that like I think the way we did it was we scrolled through her phone and she pointed, and
Oh,
I think somehow we figured out like she was able to say daughter.
okay. Mm-hmm. All
So,
right.
and I think she knew that word, and that's how we figured it out. But she was terrified of my boyfriend because he didn't know how to talk to her.
Mm-hmm.
It was just like his tone. It wasn't even what he said was wrong. All he said, because she was asking for Bustleton Avenue, which now you know I'm
Oh.
in Philly, but or everyone knows I'm in
Mm-hmm.
Philly, but I don't really care. And she kept saying Bustleton. What had happened was she was on the Market Frankfurt line, and the train had gotten diverted, and they all had to get let off and put on a shuttle to
Mm-hmm.
like continue the route.
Oh, oh no.
Yeah, so she got let out at 30th Street Station and was just like walking down Walnut Street, totally
Okay.
terrified.
Uh-huh.
And and my boyfriend was like, "Is she homeless? Is she psychotic? What does she want?" I could just feel it. And then like there was this little boy I did an assessment on, and they all thought he was psychotic, and I knew he wasn't. I don't know how I knew, but he wasn't. And I just kept saying, "Has he ever had a head injury? Has he ever had a head injury?" because that's always the number one cause. People don't usually know that of psychosis is a head
Hmm.
injury. And they
Interesting.
were like, no, no, he never had a head injury. And then all of a sudden his mom was like, well, actually, there was that one time his head was under the car tire. I was like, what? And apparently when
What?
he somehow when he was a baby, he got his head under a car tire. Like, I guess he got run over. But she said that I said, that's it. I'm like, he may have not presented with an issue then, but as your brain develops, as there's damage, it's going to come out. And he was in a delirium. Like he was, I could just, I don't know how I knew. And then it was funny because I was late that day for work, and I was like chronically late. And then in an hour, I had them set up with like a neurologist to go like right there from there. And,
Uh-huh.
and it was all, I went and confirmed with my supervisor, and they were like, you did all that in an hour? I was like, I'm
Uh-huh.
late, but I'm great. Like chronically late, but I always, and that in my life was like the only thing I feel like besides art. Sorry, go ahead.
Quick, what is the difference between delirium and psychosis? I don't even know it.
So it has to do with like, it was the way that he was moving. It was his
But
gait.
what is the definition of delirium?
I'm gonna hold on. This is why I have my books because I
Yeah,
don't
while you're
remember everything.
looking, so my understanding of psychosis is like you're hearing voices, like things,
Yes.
perceptions of reality that aren't there.
Yeah.
You know, that your
So I
senses
think,
are deceiving you.
but I forget exactly what I mean. I probably, when I was doing this assessment, used a differential diagnosis tree, which is in the back of the DSM. And a lot of people don't use that, but it's really, really helpful.
Uh-huh.
Between like, let me see if I can find one for psychosis if you want.
But what is
But like, see,
delirium? Like,
okay, I can look it up exactly and get you the, if you just give me one sec. It's
yeah,
under
no problem.
cognitive disorders, I think.
Okay.
Not a dissociative. Wait,
While
hold
you're
on.
looking this up, I'll tell you a crazy story that my dad always
Okay.
tells.
Okay.
So yesterday we're like having some family dinner function, and one of my
Yeah.
nephews asks him like, "Hey, are you a reader? You know, like, are you
Yeah.
like a big like fan of reader?" And so he's like, "Yeah,"
Yeah.
and he starts talking like, "Oh, what books do you read?" So he's talking about all these whatever books that he reads. Then he tells a story
Uh-huh.
that I've heard like 20 times, which is
Yeah.
that he couldn't read until he was like 11.
Yeah.
And then like the prevailing kind of thought at the time, so his dad is a chiropractor, and kind of like he even describes his dad as being a little woo woo, you know, so like
Yeah.
my grandpa would like tap on your temples and like other pulse points and be like, lift your arm here while I tap on the temple. So he was always doing stuff like that. And you know,
Yeah.
to some great success. I think I've actually told this story before, but where, you know, like my sister-in-law, so she's not did not grow up with him as a grandfather, you know, had like some
Uh-huh.
back pain and was seeing another chiropractor for a while,
Uh-huh.
actually another relative, and then finally went to go see my grandpa. And then like within one instance, she's like, I could just feel the knot or
Oh,
whatever,
wow.
my back dissolve. Yeah. So it's weird, you know, to kind of be, I mean, I like evidence. I
Yeah.
think like a lawyer a lot. I'm like, well, is there
Yeah.
evidence for this? You
Yes.
know? So
And did you get it in writing?
yeah, exactly. And did you get it in writing? So what they did with my dad, since my grandpa kind of was like up on some of these like theories
Yeah.
about whatever brain development, is they made him start crawling in the house. Now this may sound like a borderline child abuse, but I think when he was
Yeah.
crawling, he was especially supposed to kind of like, as he was like going forward with his like left arm and left leg, let's say, he was supposed to focus on it with his right eye, you know, and kind of
Okay.
like whatever. There was something kind of with that. And then they
Hmm.
eventually ended up getting him a crawling machine.
Huh.
So he
Okay.
could do this like 20 minutes, like a treadmill for crawling,
Uh-huh.
20 minutes a day. And then after he did this for however many weeks, he like miraculously could like read. And then he was at
Huh.
like basically zero grade level reading when he was like 11. And by the time that
Uh-huh.
grade was done, he was like, you know, at like 16-year-old grade reading and had like read
Wow.
every single book in the classroom.
Wow. From making
Yeah,
him
but
crawl?
Yes. So I've
That's
often
so,
tried to kind
I've
of,
never heard of that. That's so
yes,
interesting.
yes, I've often tried
How
to
did
kind
they
of look
figure
this up.
that out?
So there's an old theory. There's an old theory
Uh-huh.
about this. And maybe you can Google it and see, like, reading disability crawl. And people think
Hmm.
that if you don't learn to crawl, that there's like some, because all the movements that you're doing as a baby, and I guess this is
Hmm.
especially true of cystic fibrosis children because they have like
Okay.
difficulty with movements. And so the brain
Uh-huh.
kind of doesn't develop the right way that it should for things like reading and for other kind of
Uh-huh.
non-movement based brain things. Like the movement actually kind
Hmm.
of like helps the brain develop and kind of structure.
Hmm.
And if the like use it or lose it, right?
It's
So
like it
some of
turns
these
on
kind of
another
pathways,
gene.
yeah, some of these pathways just kind of die off. And so they were somehow able through this crawling therapy to like, like do
Hmm.
reinforce better this connection of whatever it was, his eyes. I think there's also people
Okay.
suggest that there's a connection between this and dyslexia, like having a
Okay.
difficulty perceiving left versus right and kind of like the
Uh-huh.
spatial order of things,
Hmm.
which is kind of necessary for reading, because
Hmm.
the
Yeah.
letters go in a particular
y-
order. That's the whole thing
Right.
of reading. So I was reading these articles, last night about it because I was like, I should finally like look this up and see what is the deal with this.
Yeah.
Because my dad was so little, he didn't know. He just went from like not
Yeah.
reading at all to being like a very voracious reader. And
Yeah.
he so I'm looking it up and people are saying, this has totally been debunked, though. This theory that there's a
What?
connection between
Really?
crawling and reading has been debunked. And I was like, that's so funny how it's been
Huh.
debunked, but there's this weird story about my dad.
Yeah. That's really
Like, what else
interesting, but
could
it's
it be? Is it a
yeah.
placebo effect? I'd really
Yeah,
love for this
maybe.
lady who
I
said
mean,
it's been debunked. I should say really quickly, because I feel strongly about empiricism,
yeah.
that when you say something's been debunked,
Yeah.
like, what does that mean? Really, I think you're trying to say is that you have not been able to prove statistically that it's effective. And so when you
Right.
say it's debunked, it makes it sound as if like, no, there's no way that could be happening. When really you just
Right.
have not been able to figure out like a test but the problem is if it's just happening to 5% of people or fewer,
Yeah.
then there will never be statistical significance because that's kind of the
Right.
cutoff.
Right. Right. Right.
So I'm always
Right.
like, "Oh, yeah, people are so quick to kind of dismiss things." But what did you
Yeah.
say is the difference
Oh, so
between,
I found the delirium,
yeah,
dementia, and
delirium?
other amnesic
Hmm.
and other cognitive disorders.
Uh-huh.
Um, the diagnostic features, I can just, let me see if it gives you the, so there's delirium due to a general medical condition. So that would be like a head injury.
Hmm.
And it gives you the associated features, blah, blah, blah. But this is the diagnostic criteria. A
Hmm.
disturbance of consciousness, reduced clarity of awareness of the environment with a reduced ability to focus, sustain, or shift attention. A change in, this is B, a change of cognition such as memory deficit, disorientation, language disturbance, or the development of a perceptual disturbance that is
Hmm.
not better accounted for by a pre-existing, established, or evolving dementia.
Hmm.
The disturbance, oh, so this is it. It develops over a short period of time, usually hours to days, and tends to fluctuate during the course of a day. So,
Hmm.
I mean, and then there's evidence from history, physical examination, or laboratory findings that the disturbance is caused by the direct physiological consequence of a general medical condition.
Hmm.
Um, so like, yeah, and I mean, there's no reason for me to like know that, but like,
Yeah.
I think part of it too is like his gait, the way that he was
Oh,
moving was like he
yeah.
was off balance, you know? That's
Uh-huh.
that was part of it too.
Hmm.
Yeah, I mean, I don't know how I know certain things. I've predicted things about people. There was a girl that I was seeing who was an adolescent, and she was so depressed, so depressed. She wouldn't talk to me about it. She had her head down on the table the whole session.
Hmm.
Um, and so I asked her to tell me a dream, and the dream was very scary. Like, and I went out and I had to have her mom sign a consent. her mom walked up to me, and it was clear that she was like abusing drugs. Like she would just look very like, and then there was a guy behind him smiling and just almost shaking and trying to talk. I knew he was going to try to kiss my ass. And I was like, that guy's molesting this girl.
Oh
I knew it.
no.
And so I went and immediately told my supervisor. He's like, well, what do you think? I told him the girl's dream. He's like, yeah, something's going on, but we still don't know what, you know. And I said, I know this is, I can feel it in my bones, you know, like I just know it. I was watching the way he was filling out all the paper. He wanted control over this situation.
Right.
You know, and he was the stepfather. And then in the week between the sessions, before I saw her the next session, she had told someone at school about it. I couldn't believe it. I was like, I told I was like, how do I know this? Like, what is this? And he was just like, well, you're a girl. You can sense a creep. I was like, all right. But to go that far to think someone's doing that. And yeah, I don't know. So yeah, that's it. But it's not much of a, I don't know how I knew that. You know, like sometimes I don't know how I know things about people. I get like images in my head. I don't know, I get feelings, but like when I got sober this time around, when I stopped drinking, it was so intense that I would just be walking down the street and this guy said hello to me. He was like an older Black man. And I said, hey, and I looked at him and he was so happy that I just said hi to him. And his I made eye contact. I could feel his loneliness and his desperation, and I couldn't take it. Like since I've been sober, I've been kind of like, I don't want to say I'm isolating myself, but I feel really comfortable in my own skin right now. Cause when I was younger, I couldn't be alone. It was so hard for me to be alone, but now I'm like really enjoying it and just being selective about who I am friends with, because I used to just tend to be friends with whoever gave me attention, you know, or gave me like narcissistic fuel. I wanted to talk about covert narcissism too a little bit, because the first time I realized I thought maybe I had some of those traits was when it was my play therapy professor. I became a play therapist, and she was an amazing therapist. And we read this article, and she was my group. At this point, she wasn't teaching me play therapy. She was my group supervisor, which means I would be doing my clinical training out in the real world in a place that's separate from my school. And I would come in and we'd talk about our cases. And she would also have us read articles to help us. And one was called Covert Narcissistic Traits in New Therapists. And I was like, uh-oh, you know, and so, and I'm very like aware of the fact that like there's like a savior thing going on with me sometimes, and that I'm not responsible, you know, for everyone's feelings all the time. You know, that was something I had to learn, and part of that comes from having narcissistic parents. Like I was providing my mother with narcissistic fuel for my like identity survival at a very young age. You know, and I've watched videos of how she like interacts with babies is very different to how she interacts with you once you become like your own person. You know, like she needed, you know, she needed like a teddy bear to like give her fuel, kind of, you know. And so when you make a child into that, where they feel like the only way, like you have to read people, give them what they want, like be what they want, and you can kind of become like a chameleon and really like lose your sense of self, other than in terms of like how you can help people, how they must have to need you.
Yeah, you use this phrase for your identity survival. You did this. What do you mean by identity survival?
Well, okay, if you believe in like object relations theory, if you've ever heard of that.
I don't know what that is.
So it stems out of, well, most people don't. I mean, I like studied this for a while. I mean, I didn't want to insult you by saying maybe if you did know about it.
No, go ahead. I don't care. Yeah.
So it's the idea that when people like, so when you're little, the theory is that you form your identity in your relationships with your primary caregivers. It's kind of like
this is called object
theory.
Relations theory.
Yes. So like, it's this idea that I have an introject or an internal representation of my caregiver inside of me that is like a mirror, except for narcissists aren't mirrors, you know? So like
Mm.
you're supposed to have this like mirroring experience, which is what I try to facilitate in play therapy. And it's like your needs aren't validated. It's only the needs of the narcissistic parent that matters.
Mm. Mm-hmm.
And so, in order to maintain that relationship and that attachment and your survival, you be and do what the narcissist needs for you to
So
do and be.
let me see if I
And
understand
so
this.
then
So in this theory, your identity as a small child, like you don't have an
mhm,
identity at first, right? Because
right, right.
you and your mom are one and
Yes,
everybody else is,
absolutely.
yeah.
Yes,
Right.
yes,
Okay. So when you start differentiating and kind of like getting differentiating
yeah,
from your mom and getting a
right.
different identity, then some of the first steps are that you need to see yourself mirrored in your parent, in your mom,
And mirroring in
for
the
your
sense
identity
of
development.
like, if I say to my mom, I really hate this kid. He's mean to me at school. And your mom is like, well, you shouldn't say that. That's not very nice. Like, you need to learn to
Mm.
get along with everyone. Or you could say, wow, it sounds like that kid's really getting on your nerves. And that's it.
Mhm.
That's being a mirror. It's taking what the person says, not trying to change it, but reflecting
Mhm.
it back to them in a way that they can gain insight.
Okay. And this is
And
important for the development of identity.
I very much believe it is. So like when normal people, well, not normal people, typically everyone really does, if they don't know how to, not know how to, but I mean, when you play with a child, a lot of adults feel like they need to teach. And I don't feel like when I do play therapy, it's a time and space where the child's allowed to do whatever they want, but there are limits to that. And limit
Mhm.
setting is like teaching the child what they need to do to maintain like this, like if you break things on purpose in the therapy session, we're not allowed to have play therapy. Like that's like
Mhm.
a rule. And then you do timeouts, but the way I do timeouts is like I'm with the child for the whole timeout.
Yeah.
Like that's and I make it play, and I make it up to them how long, because I set a timer, and like try to make them sit in the chair, not slide down the chair, or you know what I mean, or like just for even just 2 minutes, and
Mhm.
then they know that they can go back in the playroom, and they
Okay.
get, and then some kids are just completely overstimulated by the playroom. If they have like, you can see what's going on with the kid just by the way they react to the situation, because you take
Mhm.
a kid into this room with all these toys, and it's a therapeutic playroom, so I have it set up in a very like specific way, and you just tell them you can talk and play about whatever you want for this hour. That's it. That's all I say. And then I watch how they react to the room. One kid might go around and tear out every single thing and look at it and throw it on the floor and then not really do anything with it and then move on to the next thing. And you just kind
Uh-huh.
of let them do whatever they're going to do. And some kids just freeze, and they're just like, I have no idea what to do. I've never been in this situation before. Like, and then usually I give them a very like silly tour of the playroom if they don't know what to do.
Uh-huh.
So I love play therapy. It's like my favorite
Mhm.
thing. Um, did I answer a question? I'm sorry. I go off on so many tangents.
Well, you said because I think because your mom didn't mirror that
Yeah.
for the survival of your identity, I think is what
So
you
like then
said.
that's when you start to build a false identity.
Okay.
So that's
Yeah, tell me
like,
about this because I'm super interested because false
yeah.
identities, I don't have a false identity.
Mhm.
I didn't develop it, but I know that some people have them. Yeah, and how
Yeah.
does it develop and why? That'd be really interesting.
Um, it develops because you feel it's a way to have your needs met because you can't get them met another way. I learned
Mm.
that I couldn't get my needs met unless I pleased my mother, that she was going to reject me if I started to develop a real self. So what ended up happening is my real self went like underground.
Mm.
Um, and, you know, yeah, it kind of like goes, it goes underground. Well, it's covert for me, you know. Although I feel like when I've been manic, I've been like the overt narcissist, you know. And
Okay.
this is what they realize is like, you know, if whatever's going on with you is happening in cycles, like, you know, like 4 months you're manic, then you're depressed. That's how they know you have bipolar disorder. That it has
Okay.
to be over, because most people with bipolar disorder present when they're depressed, or
Mm-hmm.
if they're completely psychotic and they've hurt someone or hurt themselves. But most of the time, people who are bipolar, maybe not, maybe like bipolar 2, come in when they feel subjective distress, because mania feels really good.
Right.
Mania is like being on meth, you know?
Mm-hmm.
But I wanted to, like, I always wonder if, like, when you're a sociopath and you have this like desire to get a rush, kind of, is that,
Uh-huh.
it's like because you're in this like state of not of like low arousal or low, what did the
Yes.
person?
Yeah, super low arousal. And I guess I just kind of read another, if you are not following, you and everybody else listening, Psychopathy is on Twitter. They post all like a bunch of research and stuff. So this was from a post,
Okay.
a Twitter post, just about this little research about like the beats per minute of your heart rate
Mm-hmm.
are super low. It tends to
Okay.
track,
Yeah.
and I think I've mentioned this before, is that my girlfriend, also psychopathic,
Mm-hmm.
like she can't even wear her Apple Watch at night because she'll drop down into the 40s for beats per minute, and
Oh.
then the watch will wake her up, and so it's like constantly
Oh.
interrupting her sleep.
Wow.
Yeah, because it's so low. And one of her relatives takes medication because the heart rate is so low. And that particular
Oh wow.
relative, we kind of joke, is probably CIA
Uh-huh.
and probably a psychopath, but kind of
Okay.
like, yeah, old school, where they're kind of like, oh,
Yeah.
psychopath means killer, and I'm not, I'm just a spy or
Oh
whatever.
yeah.
So, oh,
Yeah.
okay, sure. Right. So
So
for
I was.
us, I guess
Oh,
I don't even kind of do it. I would say that it's less about the arousal. I don't care about the physical sensations that much. For
uh-huh.
me, it was a lack of engagement. And I'd be like, everything, like nothing matters at all. And so I want to kind of like do something where I feel something, so it's not
Right.
even so much like an arousal state. It's just like even
Right.
feel sad, like I want
Right.
to
Right. Anything.
feel like, yeah, I messed this up, so like that's an easy one. So I'd mess things up so I could feel like I messed it up and feel like, well, something must have mattered there because now I'm upset.
Okay. Yeah. But so do you ever feel like when someone gets into that, like I need to feel something, that it becomes like an addiction almost? Can it?
Uh, Probably. Well, so what you're trying to do as a psychopath, this is a good question, is you're just
Mm-hmm.
trying to, there's such a, like an ennui, or like a
Mm-hmm.
boredom, like an oppressive
Mm-hmm.
boredom that you feel as like a physical symptom, like the flu or
Mm-hmm. Mm-hmm.
whatever.
Mm-hmm.
But it's not depression. It's not a lack of energy. It's just a total lack
Mm.
of engagement, or a sense that that's
Okay.
what it is. And the lack
Okay.
of engagement contributes to a lack of meaning, like nothing
Right.
matters. Have you seen the movie Everything Everywhere All at Once?
No, I've been try. Is that on Hulu?
I think it's on Showtime right now. If you have
Oh, I don't see.
Showtime, the
You know,
streaming.
I just got Hulu to watch Killing Eve because you were
Oh,
talking about it.
yeah, yeah, yeah. Killing Eve, good one. So
Yeah,
there
it's
is a
so good.
character, no spoilers for Everything Everywhere
Okay.
All at Once, where she kind of experiences. I hope that fully this isn't a spoiler. She experiences so many parallel universes at once that
Uh-huh.
she's like,
Yeah.
it's just kind of all absurd or whatever. So like the French
Yes.
absurdists, that's kind of how
Yeah.
the psychopaths feel. Like Camus, like The
Yeah. Oh,
Stranger is
yeah.
probably like,
I
yeah,
read.
very, very, very psychopathic. So that's
Okay.
kind of what you're trying to do, is like you're like, and I guess too, I think Dostoevsky wrote about this once, like an experience, or maybe it was Tolstoy, where he kind of
Mm-hmm.
was like, like, does life have any meaning? If it doesn't, then I should just commit suicide. And that's kind
Myth
of
of
the crisis
Sisyphus.
there.
Was it
Yeah,
the
that
myth of Sisyphus?
well, no, I mean, this was an actual autobiographical account of like,
Oh, okay. Okay.
yeah, which
There
either
was some
Tolstoy or
book by.
Dostoevsky.
Yeah. There was some book by Camus that was about Sisyphus. But I mean,
Oh,
so here's
Camus,
my
yeah.
thing with that. Life is meaningless. It's our responsibility to create the meaning for ourselves.
That's very French absurdist. That's exactly how the French absurdists
Yeah,
feel.
I mean, I think that that's, true.
Yeah.
And I mean, I did read a lot of that back in the day. But yeah, I was just curious about like because you were talking to somebody named Risky Business. By the
Yeah.
way, I want to say something about that interview. I started crying
Really?
because, yeah, because this is what I wanted to tell you. Like the 12 steps of AA, when you get to the
Uh-huh.
end, you do the 12th step where you carry the message to people who are still drinking. And I'm like, this is like one sociopath helping another. When you were like,
Yes.
okay, here's my pitch for therapy, I was like, oh my God, I'm crying. Like, and
Mhm.
the other thing you guys often talk about is something that I feel like it needs to be focused on more is the internal states. Not so much like, okay, we know what you guys do. Like, let's move past that part. Like, cause it's always like a behavioral, like when you do the diagnosis for a sociopath, it's like, all right, what are you doing that's bad? And
Yeah.
it's more about like the internal states that make you do that.
Yes, I
And
agree.
I also, yeah, so I think who better than two sociopaths to sit down and come up with their own terms. And one of the terms that I really like, that was it Risky Business? I think it was I don't remember. Was it might have been somebody else, but he used the term primordial a lot
Oh, yeah.
for a way for sociopaths to describe this kind of like innate connection that people have that really is at a neurocognitive primordial level, having to do with, I think, mirror neurons or the lack thereof.
Uh-huh.
Maybe. I
Yeah.
think I thought that, and just because at a certain point in the conversation, I was like, wait, what are they even talking about? Like,
Yeah.
they're on this level of talking about internal state. And then when you gave him like the counterintuitive suggestion, do what you want to do in the moment, he's like, what? What? That's like, like totally. And I was like, that's interesting. That's mindfulness,
Yeah.
like being aware, like, because I live a lot like that. I'm in a position right now. I don't know how I got in there. Most of my life, I'm just like, how did I get into this? How
Mm.
this is, and a lot of like imposter syndrome too, like when I was in graduate school, because I would be really good at what I was doing, which was unusual for me to be like
Hmm.
really good. So then it gave me all this like narcissistic fuel. And then I was like, I got to be the best. And I was constantly asking for supervision. And I was told that not a lot of, they have an issue with new therapists feeling too busy or
Uh-huh.
whatever for supervision. But I was like, nope, I'm like, I know that I have countertransference and I don't want it to affect my clients. And I'm
Yeah.
willing to be open about like, you're supposed and also I was trained a lot. And this is somebody I wanted to tell you about. Have you ever heard of Nancy McWilliams?
No.
She's a great person. And I wanted to read you this part. Actually, I read this right before. So is it okay? It's short. If I read this to you, I
Yeah.
think you'll
Yeah.
really
Go ahead.
appreciate it. Okay. Okay. So they're saying how with psychopathically disturbed individuals or antisocial personality disorders as a class are both, we say, this is someone named Malloy that she's quoting, are untreatable by virtue of their diagnosis. Such a judgment ignores both individual differences and the continuous nature of severity of psychopathology. I have most commonly observed this reaction in public mental health clinicians who are assigned patients on referral from probation, parole, or the court. And also, time out. You tried to say this to Dr. Phil, and he was like, I don't even understand what you're saying. I watched Dr. Phil to criticize Dr. Phil because it's like really like the narcissistic abuse show. I was like, here you have this opportunity. And I don't think he understood, like, from my understanding, like the sociopath's biggest fear is being found out. And here you wrote this book, Confessions, you remove the mask. I'm like, what an opportunity here. Because a lot of times in therapy, you're just trying to convince people, like, actually, the problem isn't outside yourself. I don't want to hurt your feelings, but like, this is what it is. So she goes
Right.
on to say, we believe that, typically people think that no psychotherapeutic gain is possible. And this is interesting. Such reactions are often the product of attitudes that have been internalized as an oral tradition, like talk therapy, during training from a senior teaching clinicians. They are rarely the product of direct individual experience, like clinical experience with a real sociopath. It is in a sense.
Sorry, keep go.
Oh, sorry. It is in a sense a mass retaliatory attitude where moral judgment impinges on professional assessment. The behavioral pathology of the psychopath to devalue and dehumanize others becomes the concordant identification of the clinician doing this to the psychopath what the clinician perceives the psychopath doing to others. That is the most unempathic reaction that you could possibly have. And there you are, so with this, I'll say, like, lie about
who
it.
Was
doesn't
the
matter.
author? Can you give us the citation again?
Sure. This is called Psychoanalytic Diagnosis by Nancy McWilliams. And I read her a lot.
She wrote it all, or she had like other contributors?
That was a quote. That's what I just read you. If I can find the page again, was a quote by someone named Malloy. Who I don't.
Malloy is the one saying it.
Yes, she quoted Malloy. But
Malloy's the one that says that psychopaths can't be cured or can't be treated.
No, he's commenting on the fact that that's the typical view of clinicians. And that, in fact, what we do is, and I think as a culture, we do this, just like Scarface said, I'm the bad guy, I'm the bad guy for the world, and there's this woman I listened to named Dolores Cannon, who's a psychologist who did like past life regressions and then accidentally regressed people into their alien abductions. And then she claims she can, through these clients, communicate with aliens. And she says that if you're, that people make the decision like, okay, in that past life, like you were the good guy and I was the bad guy. Now, you're the bad guy, I'm the good guy. And that we all choose these things, And it's like with autism, they're like, oh, they don't have empathy because they have a problem. Well, so do sociopaths. Like there are, they've proven that it's both, made and also, but I think, there's a lot of like temperament going in. Like we don't have personalities when we're little, but we do have temperament, And I don't know what my point is with that. I forgot where I was going.
Before I forget, an article, I forget where it was, but it was last spring. I want to say it was like last February, March, April. And her name is Ariel Baskin Summers, Sommers, I think. And she says the same thing, that like there are a lot of clinicians that are just like, oh, psychopaths can't be treated. And it's like, what's the
you can't
kind of like what
them.
I said before, this has been debunked. But what does it mean for something to be debunked? It just means in empiricism, when all we're doing is either, all we can do is say that the null hypothesis is incorrect, right? That's all we can kind of do is like disprove a negative, right? So we can't prove a negative, right? That's just like, it's not possible in an empiricism. So when people say things like that, it's not scientifically valid at all. Nope. there's no possible way they could be saying it. And it's interesting that they say it anyways, because people say psychology is a soft science, and I don't think it has to be.
Well,
but there certainly are some unquestioned beliefs that bother me.
This is the thing about, so I kind of think that what the issue is like, they want to make psychology like physics. Right? It's never gonna be. It doesn't work. Yeah. I don't think it works like that.
Nothing is physics.
Even physics isn't physics?
Yeah, geneticism is not physics. Like all the science, I think, and I read this recently, where it's like when physics came out with all these crazy laws, all the sciences tried to be it. Biology tried to be it. Yeah. Chemistry tried to be it. But like physics is the only physics, really. And that's fine or whatever. But the law tried to be physics for a while. It was funny. You can look this up later. It's called legal realism, where they're like, no, well, just like physics, we'll discover that there's like some quintessential law of contracts or something. Like, it's a really
Right.
fascinating to kind of think that's what people, that's their response to physics. But I mean,
Yeah.
I wish that they would try to be a little bit more like physics. And
Yeah.
I think I've mentioned before,
Well,
anthropology gave up on empiricism altogether. How can you call
yeah.
that a science? I don't call it a
Right.
science.
Right. Wait, would they say they're interfering, right? Or
Yeah,
something?
and I'm like, but not everything's interfering. You guys just
Right.
have like, you could do like, this is what I suggested, like just ear training tests to see if these people could like
Yeah,
hear
yeah, I
certain
remember you
pitches.
saying
And
that.
they're like, no, we can't ever do it because
Right.
I was like,
That's so
okay.
funny. But I mean,
Well,
I do think go ahead.
I have a follow up with you, unless you have like something
Sure.
about this. I want to go back
No,
to
no, go
the
ahead.
thing that you said about the false identity. I have more questions.
Yeah. Okay.
But
Um,
did you have like other things you wanted to say about psychology and stuff before we move back to there?
well, I think that when I found like when I really started to get in touch with like my true self really
Mm.
was through psychedelics. And
Okay, this is
and I
interesting.
think and I think that what psychedelics do, and now they're doing, and I have two friends that are involved with this research. One of them worked with the FDA and the DEA to do the psilocybin trials and the MDMA trials. My other friend is more on the humanities side, and they're both like pitted against each other, like in this what's going on in the field. But it gives you something that they call, which is what one of my professors called the observing ego. It's
Huh.
this ability to look at yourself and your behavior with compassion, not like beating yourself up, just seeing you for yourself for who you are and being able, like as an empath, because it's like I'll forgive everybody else in the world for every bad thing they did, but not me,
Mhm.
and I don't know why. But it gives you this ability to look at yourself and like an entire relationship and like see your real part in it, but also not like to be hate yourself for it anymore. Just to see it, almost laugh at it. It gave me the ability to laugh at myself.
Mm.
And one of the experiences I brought up earlier was when I took like, so Terrence McKenna says 7 grams is a heroic dose, he calls it, and I took like
Mm.
10. And there are a strain called penis envies, if anyone's listening, who cares? But um, what ended up happening, and I did it in a ritualistic way. There's this woman named Maria Sabina, who I think what they are called, and I might be pronouncing this wrong, is curandera. They do the mushroom ritual in her culture, and she would have people. She would bless it with this resin called copal. So I blessed it. I set an intention to heal myself. Was my intention, and about halfway through, like 20 minutes or so into it, when you're kind of like feeling it coming on, you drink a large glass of cocoa with cayenne pepper. And that's a
Mhm.
weak MAOI. And that opens up your brain, your receptors receive it more. So after I did that, I was up in my bed and my boyfriend was there. And my boyfriend knows if I start crying, don't do anything. Don't touch me. Don't comfort me. Just let it come out. I love crying. I used to hate it. I
Mhm.
love it now. And I had this pain start at the bottom of my spine. And at first I thought maybe I was having a kidney stone. It was so bad. And I'm like stretching my back and like trying to get it out. I feel it moving up my spine. And I'm like, whoa, like I start to get a little scared, like what's going on. And then I'm like, I gotta smoke some weed. This is like too much. And I took a hit of weed, just like one hit, and it came up out of my face. It like popped out of my face. I just started bawling. And in my mind, I was seeing visions. I guess my eyes were closed, but I saw myself and it went really fast. It was like from when I was a little kid, all these situations where I'm in a group, nobody wants to feel a thing and I feel it and it's stuck
Mm.
in me. And as I'm remembering all these, I'm crying it out. I like purged myself. My boyfriend's like, "Are you all right?" I'm like, "Don't touch me," and like I cried. I mean, it was amazing. And then after it was over, I just like took a hot bath and it was like all this garbage was gone. You know,
Mm.
the other experience I had like that was when I was sober and I was in AA, and I was sponsoring people at this point. I had like a year sober. This is when I decided to be a therapist. I was going to give my sponsee her 1 year coin. All I was thinking about was myself. I'm nervous. I don't want to get up
Mhm.
there and say something. I have to do this. I don't even want to be at the meeting. So I'm walking up to this meeting, and this old man who I don't know is crying, and he comes up to me and he gives me a hug. I'm like, what is going on? And he's like, thank you for saving my daughter. And I
Oh,
realized it was, and I was like, it was like, this is it. This is the greatest high. You know what I mean? And obviously that's very narcissistic too, in a way, I can say that now, but it also was like, you know, and I thought, like, the way I was doing the 12 steps was I was afraid to put any of my own opinions into it. I did it exactly by the big book. And so in my opinion, I was like, wow, the big book really works. Like, I do it exactly the way it says, and it really, really works. And then one of my sponsors was like, don't you think it's a little bit you? I'm like, what do you
mm-hmm.
mean? She's like, you treat every sponsee differently. You have
Yeah.
different boundaries with them. And I'm like, yeah. And she's like, you intuitively do that. And so I just decided to go into to be a psychologist. Before that, I was an artist my whole life.
Mm-hmm.
So that's how I got into that. But I ended up relapsing in graduate school. I dropped out of 2 doctoral programs, and I was like the best in the class. People were like, why are you dropping out? And I couldn't tell them, So
Yeah.
it was, but I think that I've had great therapists in my life, and I've had awful therapists in my life. And for whatever reason, I always know when the empathy is something that can be depleted.
Mm-hmm.
And that's what burnout is. And a burnout therapist is not a good therapist. And I always had this,
Mm-hmm.
I always knew when my empathy was gone. Like if my personal life was too crazy or whatever, and I would quit or, switch or do something else. Like, I've been working in real estate for the last couple of years, doing leasing for the building. And and this was a social intervention for me, just for people who are isolated, this community, because in order to live here, you have to meet your neighbors, and you have to go to a pizza night, and that's it.
Mm-hmm.
But and if I'm in the hallway, I just constantly am introducing people, because that's like, I
Mm-hmm.
want everyone to feel like, at least when they come home, even if they don't want to hang out, they say hi to everybody. You know
Yeah.
what I mean? And that's a good feeling, to know that people are there if you need them.
Mm-hmm.
So anyway, that was a tangent. So I'll stop.
Yes. Don't worry, I'll get you back to this.
Appreciate it. I appreciate
I love
it.
it all, but I want to hear a little bit more about, so like, and maybe this helps to kind of like give you like a little bit of context about how I understand this. So I
Okay.
understand personality disorders to be some sort of disruption or dysfunction with regard to your identity, your sense of self, your
Yes.
personality, right? And so all
Yeah.
of them have like that characteristic, number one. But number two, I
Hmm.
think the distinctions between, like borderline personality
Hmm.
disorder and psychopathy versus
Hmm.
narcissistic
Yeah.
personality disorder versus uh
Yeah.
avoidant personality disorder, like all these
Yeah.
different ones, is that some of them you can kind of describe in terms of like what makes most sense to me is to describe them in terms of what is the dysfunction regarding to their identity. So, for
Hmm.
instance, psychopaths, I think that it's often helpful to understand psychopaths as having basically a weak sense of self, like
Hmm.
a
Hmm.
very like little connection to their identity at all,
Hmm.
So I
Right.
sometimes use narcissistic personality disorder and borderline personality disorder as examples of like what a psychopath is not, right? So
Yeah.
to
Yeah.
say
Yeah.
narcissistic personality disorder, they have that false sense of self. Like they have a sense of
Right.
self. They have two actually. They have the one that they project
Yeah.
to the outside of like, superiority,
Yes.
etc. So great. And then they have an internal one often that is related to feelings of shame, I think,
Yeah. Shame and
And then
guilt. Yeah.
yeah.
Humiliation.
Okay. So then borderline, they seem like chameleons, right? Like they will take
Hmm.
on the identity, like they're dating somebody who loves, the Pixies. And so
Yeah.
suddenly they're like, yeah, I also love the Pixies, this is my
Yeah.
jam,
Yeah.
and start dressing like
Yeah.
that. So kind of like teenagers in a way, that's how they kind of
Yeah.
associate, that's how they express their identity, like, oh, now I'm emo this week, and now I am
Yeah.
this week,
Yeah.
so and then for the psychopaths, it's just like a super weak sense of identity at all. Like they're a chameleon, but they're a chameleon in a way that they feel no connection to the chameleon
Right.
expression. Like the borderline person's like, no, now I am emo forever.
I am this. Yeah, yeah.
Yeah, like they say, this is me, and
Mhm.
it's never true forever, but that they have
Yeah.
that internal subjective sense that this is me forever. So I've been super
Mhm.
fascinated because I would say that my dad probably is narcissistic personality disorder.
Mhm.
Now you're the first person I think that I've talked to that
Mhm.
has like self-awareness about being narcissistic personality disorder. That's why I'm like really trying to shake you down for information just as much as you're
Yeah.
willing to share. But
Oh,
I'm just
I'll
so
share
curious
anything.
about it.
I'm a
Yeah, I'm just so
narcissist.
curious
Read me
about it.
like a book. I love it.
Well, I just
Right?
kind of want to know, like, and you don't have to talk specific to you, but just kind of what is your impression? So what you kind of stated it, but you got off it really quickly about
Yeah, I'm
like
sorry.
the no, the false sense of self. So the
Yeah.
false sense of self that you present to everybody is just something you construct to get your needs met. Is that like what
Yeah.
correct?
So I feel like I have now a strong sense of self. In my younger days, I
Partly
think
because
that
of the psychedelics, right? You said?
oh, absolutely. Yes.
Yeah, okay.
I I have like I don't even know what goes on with that. It's like it can be 10 years of therapy. It can also be very traumatizing. I don't want anyone who's going to give a public service announcement, please don't go out and do psychedelics. You don't know what's in your stuff, and there's plenty of avenues to do this like with a professional, in a safe
Yes.
space, because this
Mhm.
isn't they're not toys. And I think and I mean, this isn't to say that I haven't. I mean, I don't know what if my goal in life before I came here, I decided I was going to experience like every state of consciousness that you can possibly. I feel like that's been my goal,
Uh-huh.
and I think I've done. I think I've done every drug. I think so. I don't know. Maybe there's a lot more now, but changing my
Mhm.
consciousness has been like a big thing for me. I think initially it started with numbing my emotions. So I think part of me is getting back in touch with my feelings and learning how to like manage them in the moment. And then also this concept of like self actualization. So
Mm.
like being self actualized is like you're like just this full complete person. Like who you say you are matches what you do in life. It's fluid.
Right.
And so for me, it was like the finding a sense of self had to do first with just sitting down and being like, what are my values? Who do I want to be? Who do I try to pretend that I am? And why can't I just be that person then? Or like not be that person, but be like a realistic version of myself, have some humility. Criticism used to feel like a knife in my chest. And a lot of
Right.
my problems seem to be always manifesting into my interpersonal relationships. And I think
Mm.
like we're on this planet to have these relationships with each other. And that's how I think, like what you're doing with interviewing all these people, you're inadvertently, I think, building a sense of self through that too. I think the more you can have authentic and open relationships with people and then see how they react to your authenticity and how, you know what I mean? And see how that like plays out in the real world. I think all healing with personality disorders come in the form of relationships. And if you have a good therapist, it can be the therapeutic relationship. The healing comes like through that relationship. And I think
Hmm.
from what I remember with sociopaths or psychopaths is that your defense, everyone has a defense mechanism and omnipotent control. Does that sound like something that you would relate to, like that as a defense for you? Like
Yeah, my
want
therapist called it orchestrating is the word that
yeah,
he used, which is you're always
yes,
trying to kind of like set things up 12 steps ahead of time.
right. Yeah, yeah. And that gets draining, you know?
Mhm. Super draining.
Yeah. Um, Sometimes, I mean, there's actually, I have a book for you that could probably explain this better than me. This is the best book I've ever read about personality disorders.
Uh-huh.
Have you ever heard Search for the Real Self, Unmasking
No.
Personality Disorders of Our Age?
Oh, cool.
This is like, yeah, this is the best book that talks about like the internal states of people, their
Mm.
fantasies, their dreams, their relationships, like, And so it'll like describe a psychopath, the disorder. And the thing that happens with lots of graduate students, and it happened with me, is like I was like, oh no, uh-oh, uh-oh. But then they give you a paragraph, well, like if you're over identifying, because everyone has a little bit of this, you know, and
Right.
it'll give you like, this is what's normal at the end of like the
Uh-huh.
description. So then I'd be like, oh wait, okay. Because people, you know, everyone has like, this is my thing, my problem with ADHD. If you look in the DSM, almost every single disorder has inability to focus and lack of attention. Like if you're psychotic, you can't pay attention. If you're manic,
Uh-huh.
you can't pay attention. You know what I mean? So I don't,
Right.
they slapped me right on Ritalin when I was little, like, and that was the worst thing you could have done for someone who's predisposed to be an
Oh,
addict and also
right.
has bipolar disorder. It
Yeah.
just threw me into like mania, you know?
Mm-hmm.
So it's been like, you know, and then they put me on an antidepressant once, and that was like, it was a very old, so they kept saying, oh, she keeps relapsing, we need to get her on a different antidepressant, but the two have nothing to do with each other, really. You know, at
Yeah.
that point, that was just a defense that I had, you
Mm.
know? It wasn't necessarily related to my depression, because even if my depression's cured, I still might be an addict, you know?
Right.
Or act in it as an addict. So then they were like, well, Prozac didn't work, so we're going to put her on this old, really old antidepressant that nobody ever uses anymore, and I became psychotic. And then they were
Oh,
like,
really?
oh yeah, I became, and so I know that what it feels like to be psychotic versus tripping, you know.
Uh-huh.
And yeah, I mean, I've experienced like every state you could possibly be in, and I believe that, well, you know, it's so funny. My boyfriend was like, "Oh, you shouldn't talk about being on doing meth because that's really bad. It's like worse than heroin." And I'm just like, whatever. Like, because I think when you're on meth, like the way that I see is like you become a sociopath, like a
Oh,
very, you know. And so I wonder, like, you know, and when I'm manic, I can look like a sociopath too, because I think that I'm like God, you know, and I'm like, or, you know, I do think I have omnipotent control, you know, in some ways,
yeah.
like with my mind or whatever. Like,
Yeah.
um, but this book, I can see if I can find, what else did you want to talk more about, like authenticity and like the real self? Because I can find in
Well, I
here.
mean, you kind of answered. I guess like my
Okay.
my own kind of like perception of what happened. I want to be careful to say that, like it seems pretty clear that personality disorders, at least psychopathy, has a strong genetic component, right? Through twin
Yes,
studies, etc.
absolutely.
Right. And some people like it's, you know, we're still understanding how genetics express themselves, and when
Right.
they decide to express themselves and how,
Right.
like how it what is that kind of connection between when that stuff gets really triggered or gets triggered in one
Hmm.
way but not another way, et cetera, et cetera. So I don't want to kind of suggest that, like everybody has the same sorts of triggers that I did.
Right.
I
Right.
would say that it feels to me, my personal lived experience or kind of subjective
Hmm.
experience of what happened is that probably a trigger for me was having a narcissistic parent
Yes.
who saw everybody as an extension of himself.
Yes.
And because of that, everything was his, everything belonged to him.
Yes.
And there was just no room for me, actually. And
Right.
so kind of the same way that you developed this false sense of self for identity survival, what I did
Right.
is just disconnected from the sense of
Yes.
identity for identity
And
survival, because it was like I'm getting triggered too badly all the time. And if I keep kind
yeah.
of being personally invested in this
Yes.
identity,
Yes.
then
Absolutely.
I am
That's it.
going to die. So I was
Yeah.
like, I will
That's it. Yeah.
stop
I'm gonna
being,
die.
yeah,
Yes.
I will stop being personally invested from this identity. And that's just kind of like how mine shows up. Like now, I don't think all
That's your object
psychopaths,
relations.
yeah, I don't think all psychopaths have experienced something like that necessarily, but I wouldn't say that there's any psychopath I've ever met that has a robust sense of self. I wouldn't say that.
Right.
So,
Mhm.
they're just like everything's a spectrum, like maybe I
Mhm.
have a weaker sense of self than other psychopaths, maybe somebody might have a slightly stronger or, like even maybe average, but not super robust. I don't think that is like consistent probably. That's my prediction guess. You know, I haven't obviously met all psychopaths, nor have I
Well,
done a
yeah.
statistical sampling,
Well,
statistically significant
that's
sampling or anything.
exactly, you're exactly right though. That's you. So, and this is something with INTJs also. You're like, I'm getting hurt so bad. I don't have these needs. I'm just going to
Uh-huh.
not have these needs because
Right.
if I have these needs, they're not going to get met and I'm going to be hurt, you know. And then there comes a lot of anger with that, you know. And so I think there's just like, you don't want to be angry, you know, you don't want to have feelings, but there is like, like I think, you know, and then the need to want to like feel something. I really want to know what it feels like to be a sociopath. I mean, like, just because I used to wish I could turn my emotions off, you know what I mean, and be that
Yes.
way. And I've gone to a lot of people who people think that they're like bad people, but like you, I think you use the word enforcer, you know, they
Oh
would
yeah.
be like the people that I would go to for advice that's not emotionally based, you know,
Right.
that's based more on like logic and like and it gives me a whole different perspective that's more you know, real, I guess, you know.
Yeah.
And what you were saying about how it develops, about, you know, the whole nature nurture debate, I think that like personality disorders happen because a certain thing happens at a certain age, a certain age, a certain phase in your development, a thing will happen. And it might not be something that's traumatizing. Like, so I was just talking to someone who recently disclosed that they have borderline personality. And with borderline personality, they externalize like other people need to manage my mood.
Mm.
They give the responsibility to other people to manage their mood states that are constantly shifting, and that's why
Hmm.
they want to like become another person, because they're like, well, if I am them, like it won't be so bad because they seem to have it figured out. And narcissists and borderlines are always attracted to each other because they fulfill
Mm-mm.
each other's need. You're going to give me, you're going to make me the boss of you, and I'm going to make you a better person. You know what I mean? But really, I don't,
Uh-huh.
it's all about me, you know. And then if you don't do what I say, and then that's when the borderline feels engulfed, because now you've given them all this advice, you told them what to do, you laid it all out, and then they're just going to go do whatever they want and like forget about you because
Hmm.
you managed their mood for a sec.
Yeah.
They're good for
Hmm.
like a little while, you know. So then it feels like you're dispensable. um
Oh.
and I recently told this because I it's funny, this guy was like texting me for 3 years, and it
Uh-huh.
was always at like 3 in the morning, I knew he was an alcoholic because he used to live in my building, and we were like, you know, friends, acquaintances, but I knew I could feel the borderline, like I could just, but I liked them a lot anyway, and like because I like people, I always like people who have been alienated. Because I identify with that and I want to like
Hmm.
relieve that. Like it's like an obsession to like make, you know, if I look at someone's face and they look sad, I'm like, what's wrong? And I really need it. Like, you know, but that's also, I have to be real. What am I
Yeah.
getting out of that? You know, and I think a lot of empaths are covert narcissists a little bit, you know, because I
So
watch
I don't
these.
understand the distinction between covert narcissist, overt narcissist. I don't know these terms.
It's like overt is like, you know, what's his name? Sam Valkyrie or Sam. He's like a narcissist
Yeah.
expert, but he is a
Backman.
narcissist.
Sam.
Something
Yeah.
I for he but yeah, he's like an overt narcissist, but he's like proud of it. You know, I feel like a
Yeah.
lot of people who are narcissists like feel like proud. You know, I don't feel proud, you know, because I know like underneath of it there is this huge feeling of like I hate myself, and that's still present, but now I can laugh about it because it's kind of ridiculous, you know, like if I look at
Right.
myself objectively, you know. And I think that this is the point, like people should be judged on what they're doing. It doesn't matter if you're having murderous fantasies if you don't act on it, you know. And I think
Hmm.
we make the psychopath take these drives that have, formed whatever reason, and force them to go underground with it and shame them.
Yeah,
And then it becomes its own little monster, just kind of like you're
I
repressing it, you're repressing
agree.
it, you're repressing it. And then all of a
Yes.
sudden it comes out and it's really bad,
Yeah.
and then you're like, fuck, I just ruined my job, I ruined my life,
Yeah.
and also hurt people and lose relationships. And no sociopath wants to be alone.
Yeah. I agree. I
They
agree
don't,
that yeah, like a lot of the problems of psychopathy is like that they hide, and they hide
Yes.
because people force them to hide, or
And
else.
and it's not fair, because it's like, if
No,
you're
it's
an
not
addict
fair.
and you're like, I'm an addict, everyone's like, yay, you finally admitted it.
I know,
Yay, now we
everybody's
can
so
help you.
supportive. And like when you're an
Um,
addict, you act like a psychopath. Addicts do. You know,
yes,
I've known that addicts that
absolutely.
act like everybody acknowledges that that's true. It's like
Yes.
somehow though it's like fine if you're an addict, but if you're a psychopath and you act like a
It's
psychopath,
and it
no,
doesn't make sense.
wrong, bad, not
Yeah.
human.
And meanwhile, here you are trying to be authentic and being punished for it. So then you get the
Yeah.
message, nope, got to go back underground. Sorry,
Yeah.
can't work through your shit like everybody else can, and I know, like, I mean, I know people that like are really scary, that have, well, considered really scary, that have like murdered people and stuff, and they don't want to
Yeah.
be that way anymore.
They
And
don't.
you made such a good point that all the research is done on people who've already been violent. And guess,
Yeah.
I'm way more scared of a man, your average man, than I am, like,
Yes. And I will say this again, this is true that I'm cherry picking evidence, but like, I honestly think that who's diagnosed as a psychopath is also cherry picked. So
yeah, yeah.
so it's bad data and kind of bad data, but you can at least choose certain numbers, like certain numbers
Mhm.
support that if you take a kind of like blank slate human and you make them male, they are more
Yeah,
likely to be violent than if you take a blank slate human and you make them psychopath.
yeah, right. And like, when you do an assessment, you can assess someone for whether they're dangerous or not. And I
Exactly.
mean, I think that that is what's more important than whether you feel empathy or not. Because, like you said, you can make a decision. And if you're
Mhm.
intelligent, the decision to not do violence is rational, because it's unpredictable. You know what I mean? And you see that as because you know what I mean? What if you're an unsuccessful, maybe not so intelligent psychopath? Like, that's, I mean, also not your fault, but like, that's,
Right.
you don't have the cognitive ability, or maybe less of an ability, to see the relationship between cause and effect, you
Yes.
know, and the impulsivity might not be, as controlled or whatever.
Yeah.
But I am extremely impulsive. And you made this point. I thought it was so funny when some guy was like, well, what, Emmy Thomas doesn't care if I die or whatever. But it's like, you just met him and you were being
Yeah.
honest. And it's like, but you made the point that, like, and this is me, if someone's getting attacked, I forget about my own self, because I need to be a savior. Like,
Oh, interesting.
so like, my need to help someone or save someone is so important for my identity that I will risk myself, and I'm very impulsive. And you talked about something that actually I related to,
Real quick,
called,
let me just
oh,
comment
sorry.
that
Yeah, yeah,
resonates
please
with me
do.
so much with my dad, where like so much of my childhood was disrupted. Like, oh, you have a
Hmm.
soccer game. Well, I just feel the need to go to this old lady's house or whatever, where it was like his
Yeah.
need to be a savior really kind of like superseded everything else.
Yep. Yeah. And then likewise for me, because I couldn't be a savior for the people I really loved. And that's what I'm doing now. That's kind of like, I'm not being a therapist. I'm sitting with my feelings and really putting effort to not being selfish in my relationships. Because when you are an addict for so long, you kind of get wired to make everything about yourself and your pain and your needs, and and then the lies. Like, I lied about a lot because I didn't want people to tell me. I felt like I was protecting them from having to deal with my bullshit, you know?
Mhm.
And
Yeah.
in AA, you do something called an eighth and a ninth step, where
Mhm.
you make amends. That was really helpful for me, to even regardless of how they react. And then there's also this rule of you don't tell someone you did something bad that they don't know about just to relieve your own guilt. That's wrong in AA. Like if you cheated and you like, and say you've admitted you're cheating, but now your wife wants to know, well, who? You don't tell them who, so that they can go take revenge. And sometimes if you don't have to tell the specifics if it's really going to hurt someone, especially if you're just telling them to relieve your own pain.
Right. Interesting.
Yeah. So I thought, so there's a lot of like very specific instructions for how to go about like making amends. And I think it would be really cool if there was like a 12 steps just for sociopaths.
I often thought, I told my, like, because I, like live in California, I have like friends or friends of friends who write TV. Always like,
really?
There should be, I had an idea. I was like, there should be a show where like the psychopaths, since like the common wisdom is that they can't be treated, but they feel like they need treatment. And so instead they pretend to be an addict.
Oh,
and
yeah.
go to
There
AA meetings.
Do
So they're constantly trying to pretend, me last night, I just got, so messed up on, but you can kind of tell they're not real. They don't know what they're talking about, but they're just trying to kind of like, because
get help.
Yeah, it would. I think it would.
Yeah. But I mean, I think, Do you remember in Fight Club, the guy, he would just go to all the self-help groups?
Yes.
Because he wanted to feel something real. I have a lot of that too. Like with that guy who was texting me, it would always just be like, "Hey," and then he asked me for nude photos, and I'm like, "No." I'm like, "Why can't we?" Like after 3 years of these texts, I finally was like, I just wanted to see where this was going, and then I said, "Why don't you just ask me to hang out, man?" Like, And he was, he's used to this way that it is with social media now, like. It's easier to do that and give someone money than, form a connection. And so then we really weren't talking because he was just texting me nothing. And then finally he texts me, he's like, I relapsed last night. Like I'm having and then we had a real conversation. Like, that's what I'm looking for. I can't, and you were talking about like small talk.
Yeah.
Like in order for me to do small talk, I got to be drunk. I realized that like sometimes what I was doing with the alcohol was just dumbing myself down to connect, I don't know. There's so many there's so many things going on with me. I don't know, but sorry, did I go off on another tangent? I probably did.
No, it's been good. It's been good. I really appreciate it. The insights into addiction have been interesting. Your insights into the personality disorder. We haven't talked too much about bipolar, except you said like the Ritalin and stuff kind of accentuated it. So you would say that you're comorbid, that you're both bipolar and narcissistic personality disorder.
Well, I was never diagnosed as being, I think I have traits or a style.
I see. Yeah, a style, because your parents probably.
And I think, but I've always been very evaluated. Part of being a narcissist is being obsessed with yourself. So I've always been analyzing myself and like picking myself apart. So I think because of that, I developed like a lot of insight, and also intellectualism is a huge defense I have. Like I can talk about exactly what's going on with myself and just have no emotional like connection, but just because I've intellectualized it, And so I try really hard to like be with my feelings and, let myself be sad, let myself and not try to like change it. Cause it was always me trying to have control over myself the way I saw other people having like control over themselves,
I see. Yeah.
And I think, also, I don't know, like I even considered going to like Sex and Love Anonymous before. Like I've considered like I might just be like a hypochondriac with this stuff too, because and then the borderline thing with feeling like because since I knew I was going to talk to you, then all of a sudden like maybe I'm a sociopath, you know what I mean? But like I don't know that I'm not, like because I depend a lot on feedback from other people. you
I
know, and
see.
yeah, so I'm the book that I'm writing about, the main character doesn't know it's real, and like and the readers don't know whether it's fiction or not. Like that's
Mm,
like my book is to try to like show what it's like to not know what's like real all the time.
yeah.
And then like I don't know, I've had a lot of crazy experiences. I've done a lot of like crazy impulsive things while I was manic or off my meds, you know. And I experienced this thing that you described once called gray rage. This is what
Mm-hmm.
I remember I was going to talk about. And you said something about like feeling almost like it's predetermined, like this is the way. And you described something like everything gets quiet, kind of, and it's
Mm-hmm.
almost like in slow motion. So I had an experience like that. I was at a bar, I had a couple shots, and I was also on mushrooms, and I was on my way home, and there's this guy in my neighborhood who I know he's a very actively engaged in being a psychopath. He he drugs women and robs them, you know, and he had recently like done something to one of my friends. Um,
Mm-hmm.
and I saw him standing outside this bar with this girl who was not 21. He's gripping up her arm and he's yelling in her face. Everything got quiet. I was like, this is the time, this is the place. I'm gonna
Uh-huh.
do it. I didn't know, and it's like I don't know what I'm gonna do because it's very frame by frame. And like I go up to him and very calmly, I'm like, aren't you the guy who drugged and robbed a bunch of people? And he's like,
Mm-hmm.
what? And I see him do this thing that I never noticed he did before. He gently nudges the dude next to him, who that's his cue, hold him back because he's not going to hurt me. I
Yeah.
realize he has his little wingman to make him look
Mm-hmm.
all scary, you know, but he's not going to swing. He knows he can't swing first, right?
Yeah.
That's the rule. They had to hit you first, you know? And so he said, what did you say? And then he's giving me the death stare, like right in my eyes, but I can give it
Mm-hmm.
back because I had someone, I actually trained on this. I used to not be able to do it. So then we're in a staring contest and I'm not breaking the stare and I have a huge smile on my face. So then I had a takeout box with me of my food and he slaps it out of my hand and I'm just calm as could be. And I just said, oh, okay, there's a bouncer right there looking out the bar, not doing a thing because he doesn't like me either.
Uh-huh.
Right. And they're homeboys. And I know that this dude that I'm having the altercation with has like, he's a minion of his, this
Okay.
bouncer. So he's
Uh-huh.
just not doing anything watching this guy. He's following me and he's like, say it again. I said, aren't you the guy? You know, and I said it like slowly and I'm laughing and he's coming and the guy's holding him and he's coming, he's knocking the food out my hand. I'm just picking it up and backing away and smiling. Out of nowhere, a cop comes.
Uh-huh.
As soon as the cop there, he's like, "Oh, I'm sorry, officer. I'm sorry," and him and his whole crew like leave. And I just like walked up to the cop and I said I confronted him on drugging some women and robbing them, and that was his reaction. And I just walked away.
Wow.
Yeah, and then you know his sister wanted to fight me, but I like his sister. I think she's cool, and like so we like kind of like didn't have a beef. Like I went into the bar, you know, and I was like, she was scared because I'm like, I'm gonna nip this in the butt before she tries to come after me. I'm walking, and she, you know, and it's all like I'm intimidating all these people, and like once I get in that frame of mind, it's hard for me to like snap out of it. Um, and I
Why
had a
is it
few
hard
more.
for you to snap out of it? Because you like it, or
I
it's
get a
just like,
rush. I get a
okay.
rush. You know,
Uh-huh.
I hate to admit it,
Yeah.
but that's why I'm here, I guess, you know. Um,
Yes.
and then the worst thing, my boyfriend, he taught me how to fight.
Okay.
And that was really bad when I was drinking. But I did get 5 staples in my head. So I learned
Oh.
that lesson the hard way.
Uh-huh.
But, you know, but like, I don't know, like I do have a problem when I get into a manic phase, which something like doing something like that, when I decide to engage in something like that, that's going to trigger my mood and I know it. But
Oh.
I felt like, you know, I felt like I had, this is my corner. You're next to my
Mm,
building. You came into
mm,
my building, like, you know, and it's,
yeah.
I don't know. I don't like being that person though. Like that was when I was drinking, you know what I mean? I
Okay.
don't feel like I need to do that for whatever reason, or I don't have the impulsivity to do it.
Yeah, and gray rage, like, is not a glamorous thing. Like, for
No.
people who think that we're trying to glamorize
I
it.
know. I feel like I just glamorized it. I'm
Yeah, yeah,
sorry.
yeah, yeah, yeah. No, but not at all. But like, it
I'm
is
sorry.
kind of very much like, well, like all things, like your fight or flight kind of responses, it's
Yeah.
like gray rage. You wouldn't feel gray rage. I'll speak for myself. I wouldn't feel gray rage except for the fact that I feel vulnerable in that moment
Yeah.
to somebody. Somebody, as my girlfriend Arya always says, somebody has a false sense of their own authority over you.
Yeah.
And therefore they have a false sense of their own safety because they don't realize
I
they
I
don't
think that's
realize who
short
they're
for
messing with, right?
they
But
call
like
that
that,
duck
I mean,
down and find out.
yeah, exactly. But you don't have to, nobody has to find out or whatever. That's
Yeah.
like, if you feel like other people have to reflect back to you, or like your outside circumstances have to reflect back to you your power and that you're okay, that's not a position of strength, actually. It's not to be glamorized.
I
It shows
know.
that, yeah, it shows that you are sensitive to something, it shows that you're
Right.
triggered. Which is,
Yeah.
but it's, like, no judgment. It's just like, all things. But you said something about, that you learned how to do the stare. How did you learn how to do the stare?
Yes.
Because I think people want to hear it.
So okay. This person has passed away, and it was a really awful thing that he died. We had most people did not want me to hang out with him, but he was like, "You need to learn how to do this." I was like, "All right." and he just stared at me, and I couldn't do it. And he'd be like, "Ha ha, I saw your soul," like whatever. He was crazy. We were both crazy together. And
Uh-huh.
I couldn't do it. And this was shortly before he passed away. I was like, I don't know why I know this, but I can do it now. I can do it now. And I just stared at him till he broke the stare. I don't know.
Uh-huh.
And then I could just do it. And now I get like a rush from doing it if I have to, you know.
Okay.
It's bad. I know. I feel like maybe am I a socio? I don't. These are things
Yeah.
that I do like under when I'm on drugs, or like when I'm, like,
Yeah.
I mean, I do think I would do it if I had really felt threatened by someone.
Hmm.
I mean, that's what they do in MMA, like before they fight, they have the stare off.
Uh-huh.
And I'm always like, I'll watch them have the stare off and I'll be like, that one's going to lose.
Oh, really?
Like, just based on the look. Yeah.
Yeah. Like, I okay, so Amanda Knox did this think piece. I'll try to remember to link it, but it actually was
Okay.
really interesting. She was writing, a little bit about the Idaho University or Idaho State murders. So it's in Idaho,
Hmm.
and it was like these 4 people that were like killed in the middle of the night. Somebody just stabbed them. And then
Oh,
the guy who's been arrested, his name is, I don't remember. Arya is really into true
okay.
crime, is how I know
Me too.
all
I
these
am
things.
too.
Yeah.
Tell her to
So
watch Jim Can't Swim.
Jim can't swim.
He does these really great forensic interviews.
Oh, email it to me so I
Okay,
remember.
I definitely will.
Yeah. So Amanda Knox is talking about a lot of things. One of the things she talks about is the
Uh-huh.
stare, and she's like,
Yeah.
I've been accused. And she talks about psychopaths. It's really interesting. She talks about Sam Harris and what is it like to be in the brain of a psychopath or be in the brain of a killer. And she talks a little
Uh-huh.
bit about like moral luck, like what if you, instead of like being a Nazi concentration camp, superintendent or something, instead chose to move to Argentina in 1930. That's kind of just moral
Hmm.
luck because you avoided,
Yeah.
being a
Yeah.
war
Yeah.
criminal. Yeah, stuff like that. So
Okay.
it's very interesting. I forget what the thing is, but hopefully I've given you enough things that you can Google it. People
Oh yeah.
listening.
Yeah.
But she talks
Yeah.
about the stare, and she was like, yeah, people accused me of the stare. And it is true, people have accused this Idaho murderer guy of the stare. And they've also accused, there's in another true crime case, the Delphi murders, Delphi murders. They accused the guy who
Okay.
just got arrested for those of the stare. And I'm kind of like, I know that the stare happens or whatever. I didn't even know though, like, when I'm doing the stare, I guess it's just sometimes it's unintentional. I'm just like blanked
Yeah,
out and
I
I'm
don't
just
think
like,
it's for me, it's very intentional. I
I
had to
see.
like train myself.
Okay.
Yeah,
Yeah.
I think that's just kind of like that's just like a it's your way of thinking. You're
Yeah. Yeah.
paying
Yeah.
attention.
Yeah.
You're
Paying
paying
attention.
attention in a certain way that other people aren't paying attention.
Yeah. And some
I was
people
so
like
mad
it
at Dr.
or
Phil interviewing you. I
what?
just have to say that. I was so mad at I'm always mad at
Oh,
Dr. Phil, but I was particularly mad when he interviewed you.
someone asked me just recently about this. They were like, did you get so angry? And I was like, no, I'm okay with people disagreeing with me. Like the gray rage does
He
not
didn't
happen.
he pulled some dirty tricks on you, Emmy.
Yeah, well,
You
I'm
know,
still kind of, I don't even care that much about dirty tricks because I'm kind of like, sure, whatever. The only thing that like really triggers me, still gray rage, is like when people have like an authority. So if some, like, I don't know, who would be an authority figure, like a judge, like I still
Mhm.
am kind of susceptible to that. If a judge, is just so wrong, like I'll tell you this quick story. It's boring, so boring. But
Okay.
I'll tell you like
It's
this, I
okay.
mean,
Tell
I
me.
get gray rage about it, but luckily because I wasn't there, because I had hired
Yeah.
local counsel to go to the hearing
Okay.
instead for me, right? So what had
Uh-huh.
happened is that like a decade before, like somebody was trying to renew the judgment, right? For
Uh-huh.
the cases, like I won't get into the details, also for like the whatever client confidentiality, but they're trying
Uh-huh.
to renew the judgment. But my client, the defendant, had never been served, never properly served. They served instead
Okay.
like, the in-laws of some ex that she had, years ago, like just like real, that's not where she ever lived, it wasn't proper service. And so that violates the
Hmm.
constitutional,
Right.
like I guess the 14th Amendment due process clause, right?
Right.
So,
Yeah.
so
Yeah.
the other party was like, okay, sure, yeah, we can see that we're going to lose on this. So let's just stipulate. And there was kind of a little bit of an exchange for the stipulation. So it was basically like a settlement. Like we're going to stipulate that she was never served, and so that the previous judgment was invalid, right?
Right.
So we presented to the court being like, and stipulations are just when both sides agree, and they
Hmm.
can be common, but usually not about something like this, being like, go ahead and
Okay.
dismiss the action or
Yeah.
whatever. Right. But so it's like pretty uncommon for both parties to agree, but we did, right? Nobody wants to fight
Mhm.
this. And so we presented to the judge, like, Judge, we just need your signature. And the judge says,
Yeah.
no, I'm not going to sign this, because if I sign this, then it meant that I made a mistake 10 years ago. And I did not make a mistake. And I was
No,
like,
it's so bad.
hey, your ego is so
Yeah.
big. It's not possible. You could have made a mistake 10 years ago.
Yeah, that's ridiculous.
But stuff like that, like if like some government entity or something was like, hey, you can't this or whatever anymore, like really tried to kind of like impose their will on me and say
Yeah.
that like I couldn't do something, that would be what is triggering. Not just because
Yeah.
somebody's disagrees with me, not even just because somebody's trying to set me up to look bad,
Yeah.
that doesn't
Yeah.
make me angry.
Well, he just like when he was just like, I don't even know what you're talking about. Like
And it's
he
like,
tried to make it
okay.
like it was your issue. You made complete. I was like, what are you saying? He did not know what you were talking about. He didn't
Yeah.
know. So he had
And
to make
that's
it about
fine. At least
you.
he's admitting it. I was just like, whatever. I
I
don't
don't know. That
care.
really,
Like, I really
I
don't
did. I
care.
got
Like,
very
if
angry at him.
somebody doesn't want to understand or doesn't want to see my perspective, it's like, okay, okay. Everybody can choose their own beliefs. I
Right.
really am such an advocate for this. And absolutely feel free to disagree with me on anything, because that is your right. And I honor that right above basically almost everything else in terms of like
Okay.
my own value system. So I really like, it's not just that I'm not angry when people disagree with me. I'm really happy for them, happy that they feel the right to disagree with me,
Yeah.
happy that
He
they
wasn't
express it.
disagreeing. He was trying to act like you didn't make sense.
Yeah,
I
I mean,
felt
he
like.
can do that too, and people can believe it. See, that's their right to believe. He can try to
I
persuade
know.
people however he wants.
And then he like then
Mhm.
he like calls in the coworker. Did you know that was gonna happen?
That was kind of a weird thing, because like that
Yeah.
person is the person who told me, "Hey, you might want to consider you're a sociopath." And and then during the interview or whatever, kind of was like, just seemed to like kind of go nowhere. I was like, that's like an interesting, like I wouldn't have expected this from the person who said that you're a sociopath, is like, oh, I don't kind of remember, or whatever it was that they said.
Yeah, but you
So I was
had
like,
like,
okay.
it was just funny because he was like, I'm gonna pull out the big guns on Emmy. I'm gonna get somebody to, you know what I mean, like from her
Yeah.
work, and you just had a huge smile on your face, and I'm like, yeah,
Yeah, it's good to hear from
because
her or whatever. And I was kind of
yeah,
like, I'm not sure
but
kind of
he was
what's
trying
happening.
like he was trying to get under your skin, like as much. He
I
was
guess so.
terrified. He was scared, and I was
Well,
so
the truth is
disappointed
that
in
he
him
was really nice to me, like during the breaks, before and
behind the scenes.
after. Yeah, he was like, "Hey, how's your book going? Like here's some advice to you about this. I've written a couple books and, just blah 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 blah." Or yeah, that was it. So
Wow.
people who think like Dr. Phil is like the show or something, I'm just kind of like, everything is what it is. We don't need to,
Yeah.
stress about things.
Yeah. That's good. I
Yeah.
wouldn't have handled that well if I was up there, but I
Well,
don't think you
yeah.
go on a show.
you
I would
know,
not want to be on that.
and when I first was starting to kind of like through therapy, et cetera, start to kind of have my own fledgling sense of identity, like not fully
Mhm.
formed, that's where it's really vulnerable, is like when it's like,
Yeah.
when you see these teenagers and you're like, oh, you look really bad, your face is like they haven't grown into their features. That's kind of what it was like this identity that
Yeah.
was just kind of this like in between state. If I had like, during that time period, yes, I would have been upset by a lot of things because everything was triggering me. I had like a
Yeah.
new sense of identity. I think I've talked about this before. It was like worse than having adult braces. It was like second puberty, except
Yeah.
worse, because first puberty was fine for me. I had no problems.
Uh-huh.
So I was like, yeah, that would have triggered me during those like few years that I was like experiencing that kind of developing self. And I always feel really badly for people who are going through that, but like I just
Yeah.
say stick with it. You can
Yeah.
just you can learn to regulate your emotions. You can learn to do all these
Yeah.
things. Everybody can learn. It's okay.
Yeah.
And if it takes a few
Absolutely.
years, it doesn't matter.
It's
You want to
yeah.
get through it anyways, so might as well just check it off your list. Just start today. Start today to
Yeah.
be who you want to be, your true self, live your truth
Yeah.
100% you 100% of the time.
Yeah. And then risky business was scared to do that though.
I know. I know, but that's their choice, and sometimes it's kind of
Yeah.
like,
Well,
again, I feel
yeah.
this is another parallel to addiction, where sometimes you
Yeah.
just have to kind of like reach a point where you're like, you have to I think you have to know there's no way that living this life can work out, at least not
Yeah.
long term. You have to know it's not
Right.
sustainable. And however, whatever
Hmm.
it takes for you to get to that point where that that even though it's hard to do it this other way, that it's basically your only choice for like
Yeah.
long term life satisfaction, happiness, fulfillment.
Yeah. It definitely is. Yeah. You hit a bottom with any behavior you can that's like not, yeah. Yeah. You've done a lot of really interesting interviews for sure.
Okay, thank
I was,
you.
I actually wrote some notes down. Hold on. Let me see if I can find them amongst all my notes. Oh, did I leave my notes in the basement? I may have left my notes in the basement, but oh, that stinks. Yeah, I think I was talking about just making up your own like lexicon with the people that you're interacting with to describe your internal states. I think
Hmm.
is like, because that's the thing that people who aren't like with the same brain setup as you like don't get. And I think that when you understand the internal states of anyone, you have empathy.
Yeah.
you know why they're doing what they're doing. Everyone, like, and this is a term that comes from like schizophrenia, this book called Schizophrenia Genesis, this idea of private logic, that we
Mm.
have like a private like worldview and way of thinking about things. And I think as a therapist, like, there's this quote by Carl Rogers that's like, the curious paradox is that I have to accept myself just as I am, then I can change. I
Yes.
think that it is a paradox. Like, you can't change until you see the point. And, it takes a lot of going through cycles of the same thing to get the
Yeah,
point.
who is the quote for this? I'm gonna write it down. Carl.
Carl Rogers.
Okay.
Yeah, actually, I have his book, and I think it has a really good illustration on the cover for kind of like what you're doing.
Mm-hmm.
It's see the two people, and
Uh-huh.
then they're both talking, and there's like a common language that like forms between them.
Right.
That's that to me is therapy. It's like the whole first part of therapy isn't changing the person at all. You accept people like right where they're at, and you meet them where they're at,
Oh yeah.
and the whole goal in the beginning is just understanding who they are, what it is to be them, to wake up in the morning, put on, and
Right.
like, and once you like get that, you probably formed a relationship and a rapport with the person because they see that you're not trying to change them, you're just trying to understand,
Mm-hmm.
and that takes away a lot of the defense. And then the thing with like the sociopaths I've worked with is they want to like lie, because to them they enter it like it's a game, which is fine. And a lot of the people in school, like the grad students, were like, "Well, what do you do if your client's lying?" And it's like
Mm-hmm.
nothing. You say, "Yeah, you can get over on me if you want. Is that what you want to
Yeah.
do?"
Uh-huh.
Is that going to give you what you came here for?
Mm-hmm.
And then not play the game. And I think that the projection that society, you know, yeah, it's like, or you can engage in that dynamic where it's a control game. It's who's getting
Mm-hmm.
over who, and you
Yeah.
have to try to remove yourself from that game. And the only way you can do that is with like unconditional positive regard. Like,
Right.
my friend, he was living with me because he was going through a really hard time. Nobody liked him anymore. Everyone was like scared of him, and he had like attempted suicide. And I just was like, just stay with me. And every day he would. We didn't have a relationship like that. We were genuinely just friends, which is also new for me to have like
Mm-hmm.
a male friend that it didn't, and every day he'd wake up and come, we'd talk about our dreams in the morning. We'd like interpret our dreams, like come up with a plan for the day and like try to execute it and like come
Mm-hmm.
back and like talk about it. And we did that for like 6 months, and we really got attached. And this is someone who thought he was bad to the core, done bad things, never going to be good. Like, this is my identity. And um, he had this experience where someone had taken something from him that really meant a lot to him. It was a collection of things he had had. They
Mm-hmm.
wouldn't give it back. It was the end of a relationship. And for months, he was like, I want to just put sugar in her gas tank. Why can't I
Mm-hmm.
just put sugar in her? And he would ask me, and I'd be like, it's not going to get your tools back. It could
Yeah.
potentially create like more problems for you. She's going to
Yeah.
know that you did it. Um, and then he's like, you're right. But he kept bringing it up, wanting to do it. And then on Christmas Eve, we were having an event here, and the former partner of this girl who has his tools was going to
Mm-hmm.
have an event there. And then this guy was also going to be there. So they knew they were
Mm-hmm.
going to see each other. That guy, for no reason, grabbed the tools from this girl's house, brought it to him on that
Mm-hmm.
night, and that was that. And he couldn't believe it. Like, he was like, look. And he's like, and I didn't do the thing, and on Christmas Eve I got my tool. And it changed for him. Like, I think
Yeah.
he needed to see that, like, if I do good, the world's going to reciprocate, you
Right.
know that was like a big deal for him. And I thought that was really cool. And then the other thing was, like, he had done something that he considered very bad.
Mm-hmm.
Somebody else in my building knew about it, so he knew they were going to tell me, because that's the type of person they are.
Yeah.
And so he felt like he had to come home and like confess. And I knew he was looking at the ground, telling me the story slowly, and we get to the
Mm-hmm.
climax, and it's bad, and he looks at me, and I'm like, I still love you, man. Like,
Mm-hmm.
you know and that was an important experience for him,
Right.
yeah, he did a bad thing. It wasn't the best way to handle it. I understand why you did it. I understand who you are and what that meant for you, and like your history. And I have empathy for you, not the
Mm-hmm.
stranger. Sorry,
Yeah.
stranger, but like, you're not my,
Mm-hmm.
and I think that meant a lot to him. And he's the most loyal person. Um, he knows he can scare people he doesn't want to.
Mm-hmm.
Um, but I mean, I think everyone can change. Everyone deserves a chance, and I think that, you're getting rid of your biggest defense when you take the mask off and tell people.
Yeah.
And for a therapist, that's a big deal. Like if you have a sociopath that finally admits like, yeah,
Mhm.
like that's a huge breakthrough. That's like a huge, like that's half the battle really, sometimes.
Right.
Um, but I've also worked with little kids who are developing, uh, you know, very like hurting other kids and laughing type of stuff. And there was a girl I did play therapy with who, like everyone, like she got kicked out of her. It was a classroom, but they're really group rooms because it was like a day program where it looked like classrooms. So they felt like they were at school, but it was really all about helping them interact. And she had been
Hmm.
kicked out of like the room for like the bad kids or whatever, you know?
Wow.
And in a session, she took this piece of paper that was like the list of all the groups and who was in it. And she
Hmm.
cut out like a tiny square, which was her old room that she had gotten kicked out of. She just like
Mm.
cut it out and like handed it to me. And I was like, "Do you miss that room?" She's like, "Yeah." I was like, "Do you wish that you could like go back and like say something like or whatever?" She's like, "Yeah." And we did. We just got right up and like left the session, went to the room, and the woman who did the group was a really great therapist. She did not like this kid. But like I
Hmm.
brought her into the room and I showed her, I was like, she just cut this out and she wanted to say something. And she said, what she said, and it really melted the woman's heart.
Mm.
And like she saw the internal state, and that was a very healing moment for that girl. And I
Yeah.
remember I talked to my supervisor. I was like, "How do you teach a child empathy?" She's like, "I don't know if you're going to be able to do that in the time that you have."
Hmm.
And but I did play therapy with her, and I remember she wanted to help me with everything I did. And she saw me doing this activity with another child, which was like a water table. She's like, "Can I do that too?" Like, "Yeah, you can do that too." Like, and we did that. And she was singing a song about teamwork while we were
Hmm.
carrying the tray out together. And the psychiatrist saw this kid doing it and he dropped his jaw, you know,
Hmm.
and I wish I would have had more time with her. Like I remember all my clients, like pretty much like, I don't know how I did that, but I would sit there without the case file open and like know everything about the client. Like I don't
Hmm.
know. I miss being a therapist, but I needed to take a break to get myself together.
Yeah.
I might go back to it, but I really need to get solid with being sober and doing this. I like being an artist right now. That's been like
Hmm.
really good for me, making art and working with other artists too here has been great. But I do really miss working with kids because I was like really good at it. And I think the earlier you intervene, the better. Do you
Yeah,
work
I
with kids
agree.
or
Not
like
really.
have you were you I mean I think of you as like a therapist because I
Hmm.
watch you do these interviews and like you do better like than most therapists and like I really think you should like I mean I think that there should be like a group that's like similar to DBT because in
Yeah.
DBT you have all these people in a group together who also have their individual therapists who are also in the
Mm.
group and the rule is because every like people with borderline they're all going to have inappropriate relationships with each other and break all the boundaries and the only rule is whatever you're going to do with another person in this group you got to bring it to the group like you have
Mm.
to talk about it in the group and I think that's like really helpful and then also your therapist is in the group with you because I think it's really important for personality disordered people to not have just group they have to have the individual with it I
Hmm.
think, because they need the individualized attention and that one-on-one relationship heals. And it typically takes, from what I learned from uh, from like psychoanalytic therapy, is that it can take up to 2 years to
Mm.
form the relationship with someone who has a personality disorder,
Okay.
and that's normal. That 2 year period. Um, that's what I've heard. So it can take a little bit longer with
Yeah.
that because of the relationship, because you heal through the therapeutic relationship, through the mirroring. Um, yeah, it sounds like you've had great therapists.
Oh yeah, the one. Yes, he's like a genius.
Yeah, that's awesome.
Yeah.
I've had a lot of really good ones and a lot of bad ones. Um, but yeah, and I'm still in therapy. I think I'll always be in therapy.
Hmm.
Just because, you know, that feeling of like I need a second opinion on is this real?
Yeah.
You know? So, but yeah, and I like client-centered therapy a lot, because there was a research article about that being the most, you know, culturally sensitive method, because you don't
Mm.
follow rules and you follow principles. Like there's the 8 principles of play therapy. And I think that's, you know, these manuals that people use, like, oh, you're depressed, here's the manual. Well, guess what? Like the population that study was done on, like they'll take, okay, we want to study depressed people, but you can't be suicidal and you
Mm.
can't like have had, you know, a history of drug addiction. And you get like, who is this person?
Yeah.
That's not a person, you know, that's not a real person. Because what happens is it's like peeling an onion. Someone
Mm.
comes in for depression. Like, I mean, the one client I had that I really, really messed up on, because but if I would have paid attention, well, I mean, it's very rare that someone with paranoid personality disorder shows up in therapy. People think that, you know, for me, a paranoid personality disorder is the most difficult to treat.
Mm.
They really, they suck. That person sucked me right into the dynamic and triggered me to act like an asshole, you know,
Oh,
to
really?
a way that, well, not like an asshole, but like the way that I don't think of myself as a therapist. I reacted, you know,
Hmm.
um, and someone with and I read my notes from my class on personality disorders. This person presented as very depressed, completely
Mm.
just depressed, victim, depressed. There was no signs of any type of delusion going on initially. Um, and then she told me this one story, and I don't want to tell the story because it's very specific, but like
Right.
it was clearly something that I was like, can that happen? How does that happen? What would be the motivation for someone tricking this person like that? You know,
Yeah.
and I'm fully in this person's head, right? I have so
Uh-huh.
much empathy that I'm like, yeah, that's weird. You know, like I'm with them on it, right? I think this is
Hmm.
crazy, and I go tell my supervisor. He's like, that's not real, and I'm like, really? You know,
Uh-huh.
and then as it went on, she at some point asked me, well, what is your assessment of me? And that's a
Uh-huh.
real tricky question when you have someone who's paranoid, right?
Yeah.
If I'm, you know, on one hand, I feel like I ethically have a responsibility to give this person my perception
Uh-huh.
as a clinician on what's going on. However, they're not ready to hear that they're paranoid because they don't think they're
Right.
paranoid. They believe all these things. And that's
Well,
highly
it would be
insulting.
very destabilizing to them to hear
Yeah.
that. Yeah.
But I mean, so this is where I messed up, you know, like I aired on the side of this person deserves to know type
Okay.
of feeling. Like it's unethical for me not to be honest. But then I had never worked with someone who had paranoid personality before. And I, you
Okay.
know, was fairly new. Um, so I told her she was she had what I thought, you know, and I used
Hmm.
that word and I shouldn't have used that word, you know, in hindsight, but I was still learning and I was in the heat of the moment, you know, and I went with my intuition. That was wrong. She came in next week and she had a letter. She had a list of everything I had done wrong so far. And up until this point, I thought we had a great relationship, you
Uh-huh.
know, and what one of the things that clued me in that she had personality disorders was something my professor that I remembered, he said they have a huge list of people they hate. She didn't like
Oh.
gay people. She didn't like gay people. She was convinced that like someone at her work was gay and trying to like, but then there also is sometimes an underlying denial of being gay that goes
Mm.
along with that, which is like a reaction formation defense.
Oh.
Um, and so yeah, she had a list of hates, you know, and you know the people that go around on their car with like a megaphone,
Oh,
you
yeah, yeah,
know,
yeah.
like
Uh-huh.
yeah, like listing what they hate or you know, like
Yeah, no,
that is
I've gone
kind of.
I go to like Mardi
Yeah.
Gras and it's like fags, like liars, adulterers, like their list of people all going to hell or whatever, like
Yeah.
started
Yeah.
as
Yeah. That might be someone who has paranoid
horror, but
personality.
that's how they think of it. Yeah.
Yeah. And they're very persecuted.
Mhm.
And that's their own disowned rage is they're experiencing their own disowned rage from other people, but they're the ones who are angry.
Mhm.
And they don't know that, so they make it. Yeah, it's really interesting. So she came in with this list of all my flaws, which as a
Mhm.
covert narcissist was not expecting that day. Like if I know like that might happen, like I'm kind of prepared for it. Like I can sense the attitude, of like,
Yeah.
they're already correcting me on things, or telling me what I don't know, or like I can usually feel that and like therefore not react to it. But I was
Mhm.
not expecting this day, and like, yeah, I don't remember what I think I asked her to leave because I knew I was getting like too, and I was really upset. I was devastated by the way I had acted, and I like told
Yeah.
my supervisor, and he said, "Well, don't you know that those are impossible to work? Like that's impossible." And
Mhm.
so of course I don't want it to be impossible. I don't
Right.
believe that it's impossible. It may have been impossible for me
Yeah.
at that, and but yeah, but when I read my notes, the first thing I read was a paranoid person, paranoid personality, not paranoid like schizophrenic paranoia, personality disorder. They'll
Mhm.
always present as depressed.
Oh,
If
interesting.
I would have read those notes,
Mhm.
I went back to my notes from that class because he was so good, and
Yeah.
I was like, oh man, it was if I would have remembered that point, but I'll never forget that again. I'll
I
never
know.
forget that.
Yeah. That's life. That's life. You just have to like make the
Yeah,
mistake and then be like, oof, okay, never again.
yeah, yeah. That was. I still remember that. I learned a lot, about that. But it's very rare that they are successful in therapy. I've heard, and I've read, and I think at the time I probably delve heavy into the research because when I make a mistake, I'm like, what?
Mhm.
But and I make a lot of mistakes. So not a lot, but I
Yeah,
mean, I make enough that but that's how you learn. You can't always succeed. You have to fail. And I had to learn that too. I
I
look at my
agree.
life and I see a lot of failures, but it depends on what mood I'm in too. Like there's something with bipolar disorder where the memories can get messed up because when I'm depressed, I only remember the memories I made when I was in a state of depression.
Oh, yeah.
It's
Mhm.
it's called state dependent learning.
Okay.
They did a study where they taught people a class underwater. They were in like scuba, like like they were in a pool
Yeah.
underwater, able to breathe or whatever. They taught them the class there, and then they taught them the class in a regular classroom. Then they would, I think it was two different groups. I can't remember exactly,
Right,
but
right, right.
basically
Mhm.
they showed that if someone learned in water and you test them in the water, they do better than if you take them out of the water and give them the same test out of water because they
Yeah,
learned it
yeah.
when they were in that state. So it's the same thing with like mood disorders. When
Right.
I'm manic, I've always been great. I've always been on top of the world. I've always had
Mm.
supernatural. I've always been this way. This is who I am. And then when I'm depressed, all I see is, so I'm very aware of that. So I consciously will try to make myself think the opposite or remember a different memory.
Oh, that's interesting. And then it's self-reinforcing.
Yeah, I can put myself back into a place, there's something called, actually, you might be interested. It was developed by the CIA, an institute called the Monroe Institute, and it's something called hemisync meditations.
Mhm.
And it's like to link the two hemispheres of your brain. And you go through all these meditations, and supposedly you're supposed to be able to leave your body and like travel around and
I will
have all
write
these
this
like
down.
special. Oh yeah, it's really cool, and it's very relaxing to do the meditation. You have to do it with headphones.
Okay.
And then there's a video on a channel called Video Advice where they go through like the whole document and the theories behind everything that they're doing during these meditations.
Mm-hmm.
But I use that a lot.
Hmm.
Yeah. And mindfulness,
Yeah.
to cope with everything that's going on with me. So sorry, that was a huge tangent. Did you want to?
No, it was great, but I am,
Oh,
I have bladder pressure and my
yeah,
mind
me
is
too.
like
Me too. I
exhausted.
was like, what do I tell
Uh-huh.
her?
So if you don't mind, like kind of thinking like, is there anything else you want to talk about before we wrap up?
um, I mean, I could probably talk to you forever, but no, not that I can think of right now. If this is a good time to end, that's fine with me.
Yeah, but I hope to have you back on soon, especially,
Oh yeah, I would love it.
I'll check out HemiSync and I'll check out some of these other things.
Yeah,
It's been really interesting getting your insights about, both kind of experiencing a personality disorder, or at least, like what I think what you said, features, or I forget what it
yeah,
was.
traits, style.
Yeah,
Yeah,
style. Yeah. And also having treated personality disorders,
yeah,
especially
yeah,
little children. I'm so glad that you
yeah.
you tried to help that little girl. And I do
Oh
agree
yeah,
that early intervention, and it's kind of sad because uh I think people kind of like say, okay, psychopaths terrible or whatever. And I'm like, well, what's the point of that? They still exist or whatever. Like, so
yeah,
do you
exactly.
want
How
them to
are you
get
helping?
cured or not? Yeah. Like, do
Right,
you,
exactly. It doesn't
and
make
then
sense. Yeah,
yeah, and if you don't give money to like the research and stuff, you're not going to be able to find the therapeutic interventions that are going to work,
yeah.
right?
Well,
And
obviously, it's
hopefully,
because you guys need to be punished.
yeah,
No,
because we're just like
it
moral
is.
outcasts, not human,
Yeah.
like we're soulless. And so there you go.
And
So
then who's the sociopath? If I'm telling you, if that's my attitude, then and then that's the mistake of therapists. Now you're in the game with the psych. You know what I mean? You need to
mhm,
step out of that, and not
yeah,
because the therapist wants to have control, I guess,
yeah,
and you have to give up control and realize that you don't have control over this person. You can help them and create a situation where they can
yeah,
heal and like do the best you can to try to like really understand them to the point where they really feel like you know them and still like accept them and regard them positively no matter what they're telling you. That's so healing. I mean, that's love, and that's what you have to heal with. You can't heal, you can't get sucked into any client's cycle, because even if they don't have a personality disorder, and even healthy people, everyone's going through a cycle. Everyone's
yes,
like everyone's enacting something. Everyone has an unconscious, that's not like, it's just that it's like with the people with personality disorders, I feel like it's like everyone can see them around them first, see it first. And same thing with addiction too. Usually people are like, you got a little problem there. No, I'm fine, and then you just surround yourself with other people who drink like you. Or like, or find someone who's like worse off that you're helping, or that's me, I guess, you know?
mhm.
But
No, I
yeah, I
agree.
don't, yeah.
One thing my therapist said to me that really helped me to kind of just like let go of my own expectations about when people need to change, because as a child of a narcissist or whatever, there were
Yeah.
certain, as I kind of like realized, okay, I am this way because of these things. And yes, I did suffer
Hmm.
some abuse and whatever.
Yeah.
Then there's like a frustration that kind of can tend to come along with it, and like kind of wanting him to change and heal and do it now.
Yeah.
And so my
Yeah.
therapist would be like, I mean, everybody learns in different sequences. Something that was
Yeah.
so easy for you to learn and you learned it
Right.
first might be something that's very difficult for somebody. They'll learn it
Oh
last.
yeah.
And we really don't know when we see other people, like, since they're learning in such a different sequence, I'm maybe they're really advanced about certain things
Right.
that I have yet to learn. So I think that has
Yeah.
just really helped me to understand that, like, even though I kind of want to demand, and I think often therapists or, the clinical psychologists kind of want to demand of the psychopath, like this now, this awareness,
Yeah.
this remorse, this, before I
Yeah.
deem you worthy of treatment, or before I deem you worthy of like your humanity, we need you
Yeah.
first to acknowledge that you're not human,
Yeah.
or whatever, I feel
Weird.
like it's bum bum. And if you can just
It
be
is.
like, this is where this person is right now.
That's what you're supposed to do. That's how I learned.
Yeah.
Why, how the person's not going to be like, healthy coming in,
Yeah, exactly.
and I
We
think
say that
that
at
when,
church, church is not for the, like church is a hospital. It's for the people
yeah,
who are struggling, not for the people
yeah,
who are doing great.
yeah. And just one thing about the girl that I worked with, who you had mentioned, that was, the girl, I remember, I think the moment when she may have learned empathy was she said, like, somebody hurt her or something. I said, oh, I don't remember what I said, but she's like, I said, I think I may have said, like, what did that make you feel like? And she looked at me and she said, what does it make you feel like? I said, what does it make me feel like that you got hurt? It makes me sad because you're my friend. And, like, I don't want my friends to get hurt. That was new to her. I
Mm,
saw the wheels turn. She didn't even know that a friend didn't torture you, you
yeah.
know?
Mhm.
And so, yeah, that was a beautiful moment
Mhm.
to watch that, like to see that recognition in a child, like this, oh, this is it, you know?
Yeah.
It was beautiful, And I really, I don't know, I see you being able to like work with people or, in a different way. And I really think you should write down, like, whenever, like, because you're always like, oh, you use this word. What do you mean by that? Like, that's really important, you
Mhm.
know? And one of the words actually you mentioned, I keep going back to Dr. Phil, I'm sorry, but
No,
you
no, go
said,
ahead.
with Aria, when she called you, right? She was the one who called in
No,
on
like
Dr.
during
Phil.
Dr. Phil? No, that was somebody else.
Oh, okay. I thought, and you said, I may humor you a little bit. What does that mean for you? You said like,
Humor.
like
So
you
I
were
said this
saying
to
like, oh,
Dr. Phil.
yeah, you said like, well, you were in response to the person from your work being like, well, are you trying to manipulate me? And
Oh,
you said,
yeah.
and you were like, well, I may have humored you.
Yeah, humored. So in my, yeah, the way that I would use that word is like, let's say she's kind of like, let's say we have different politics or whatever. I'm not
Right.
going to be like, oh, I disagree, or, that seems factually incorrect. So I'll be like, oh, yeah, it's totally true. Totally true how this is.
Okay.
That's what I mean. And
So
that
I'm
is
curious.
manipulating people. But
Yeah,
also,
yeah,
I think of it as humoring her. Like, you're just going along with her, whatever she's saying,
yeah. You don't feel like
but
having a debate.
yeah, exactly.
Yeah,
Or maybe
I
even to
mean,
just like establish a rapport. I mean, it's not even just
right,
like I was
right.
avoiding a debate. Like it was manipulative.
Yeah, but I mean, okay, and oh, I'm so glad you brought up the word manipulative. What's the difference
Mhm.
between manipulation and persuasion?
See, this is like another interesting thing. And if you've seen a lot of my videos, it seems like you have. Then I am writing
Yeah.
at least a book proposal for
Oh,
a
sweet.
second book. Yeah. And so
Nice.
I talk about this like quite a bit about like autonomy and what does it mean for somebody recently wrote this as a comment to a YouTube link. And I think it's good to kind of use words that other people use too as synonyms. So Mormons
Hmm.
would say agency. That's the word that they
Okay.
would use. And this woman said sovereignty. You're like kind of personal
Hmm.
sovereignty over, and I think that's also a good word. Or what did I say? Autonomy. That's the word I think I
Hmm.
use in the book. But they all kind of
Hmm.
mean the same idea of like everybody has the right to live their own life,
Yeah.
And
Yeah.
that's
Yeah.
why what we mean when we say that's none of your business is like, no,
Yeah.
it's my business, not your business. Like, so there is some sort of
Yeah.
line there that we seem to acknowledge. And the Mormon church, there's like a Mormon
Hmm.
scripture that has a really good it's in Doctrine and Covenants, and I'm going to forget, like maybe 108 or something, but it says that no power or basically authority, they say priesthood, but priesthood is kind of like equivalent to authority, like a synonym.
Hmm.
No power or
Yeah.
authority can be maintained against another person by virtue of that position of authority. So just because you're in a
Yeah.
position of authority doesn't mean that you should exercise authority over that person. So they said
Right.
only by gentleness, meekness, persuasion, love
Yep.
unfeigned, uh, like knowledge,
Hmm.
true knowledge or something. So it's basically kind of giving you like what's, so I kind of like shorten it to gentle persuasion.
Okay.
Because so I say it's okay to gently persuade people, but it has to be a gentleness to it. It can't be
Yeah.
like it can't be that you're withholding. So I even mentioned in the book like a story about my uncle, who he told his parents, he was like, I'm not going to go on a mission if I get accepted to this college. So what happened is my
Mhm.
grandpa monitored the mail, saw the acceptance letter, and then just like threw it
Yeah.
away. Then my uncle
Oh,
assumed, I know, he assumed he didn't get into the college, so he went on the mission. But then he later found out about the deception, and he left the church. So it's like,
yeah.
well, you should not try to interfere with people's choices like that.
Yeah.
So that's why I say gentle persuasion. Like if you,
Yeah.
you can't do anything. It has to be informed consent, fully informed consent.
Right. Yeah. You have to know you're being
Yeah.
persuaded. Yeah, I
Yeah,
guess
and
that's the
giving somebody
difference.
knowledge and being like, well, can I give you some advice or something? And they say yes, and suggest it and be like, it's up to you. I know it's up to you, and I want you to feel free.
Yeah.
And I'm not going to like you any less if you choose
Yeah,
differently.
that's what I always say. That's
Mhm.
exactly what I said to my friend